So let's start. Good morning, everyone. Thank you to the Regional Forum on Pollution in Nairobi, Kenya. I would like to give the mic to the head of security so that he can walk you through safety. And after that, we'll begin the program. Thank you.
Good morning, everyone. I have a little bit an issue with my voice, but I think I'm audible enough. My name is Daniel Osweto, Security Supervisor, Pullman and Maki Hotel. I just want to give you an overview of what you can do in case of emergency. I'm talking about safety and security. In case of any emergencies, we are not anticipating anyone, but emergency do occur unannounced. Now, where you're seated, as much as I know, you are very safe. And the question at the back of our mind is that should anything happen, what do we do from here? So I just want to give you an assurance that we have enough trained fire marshal team, that is in case of fire. And we also have enough trained first aiders on board. So if you have an emergency here, how do we go out? Right behind me, this is the primary fire emergency exit point. But there's a backdrop banner, which I see definitely as not permanently obstructed, but temporarily it can be moved. So we can get out from both ends. This wing is called the north wing, the other wing is called the south wing. Across the lobby, towards the toilets, there is an emergency exit all the way down to the ground floor. The one behind me, same way, all the way to the ground floor, to the fire assembly point. So of course, during evacuation, it's a process that you'll be guided through. We'll have the fire marshals on board. So you'll not be alone. And in case of any injuries, we'll have trained first aiders. In case of emergency aside, you can also have some form of sickness, which is an emergency as well. It is not planned. We have a doctor on call, just a call away. So entirely the situation in terms of emergency is we have all the equipment necessary for mitigating any form of situation. Fire alarm system is operational and is all operating and up and running. I also would want to advise in-house guests, those who are in room, that we have provided in-room safes that you can use to keep your valuables. Kindly make sure that every time you lock your valuables in the safe. And while living here, there are portable items like very personal effects like phones, portable small things you can carry with you. But when you break for your lunch, we'll deploy a security officer to man this room. If you leave probably laptops behind. So that's a security provision that you are rest assured of. Our security setup also has armed security. We have 2 armed security board. So at times, maybe you can see them patrolling around. You see somebody holding a firearm. We are not in any state of emergency. They're just guarding your lives. So make sure, make sure you're safe. Also, personal security, take care of yourself, even as we are taking care of you. I know that you are in safe hands and everything will go smooth and well. You are all welcome on board. Enjoy your session. Thank you very much.
Thank you. Good morning, distinguished guests, country representatives, National Environment Management Authority, UK government, Global Alliance on Health and Pollution, representatives from Kenya, from Uganda, from Ethiopia, from Tanzania. Welcome all. Today begins the first day of the working for the Regional Pollution Forum in Sub-Saharan Africa. My name is Hassanatu Anasamake, and I will be facilitating the forum along with Alice Evans, who's also the program manager for the UK government for the Department for Environment, Food and Rural Affairs. We are pleased to support this important national regional dialogue here, bringing all of you to discuss the pollution agenda, the challenges, and how we can all individually or as organizations or as countries work together to manage pollutions that is impacting regionally, nationally, and globally. On behalf of the UK government, for the Department for Environment, Food and Rural Affairs, the Global Alliance on Health and Pollution, and the National Environment Management Authority, I warmly welcome you to the Regional Pollution Forum. To formally open the forum, it is my pleasure to welcome Lolem Lakole, Assistant Director, Public Health and Deputy Head Division of Environment Health for the welcome remark. Followed by him, we will have a presentation, the speech by Dr. Tambushi Leonard, who's also Deputy Director, Pollution Control and Waste Management for NEMA, Kenya. And after this remark, we will have Mrs. Tox Askinsheye, who's the head of the International Hub for Chemicals and Hazardous Waste, Department for Environment and Rural Affairs of the United Kingdom. Thank you. We will have the speakers in this order. Dr. Lula.
Yes, thank you. Thank you very much, moderator. And good morning, all the participants, and welcome to Nairobi. On behalf of the Minister of Health, I am going to read the remarks from our minister. We refer the minister here in Kenya as Cabinet Secretary, Honorable Adan Duale, EGH Cabinet Secretary, Ministry of Health, during the opening of this Regional Pollution Forum in Sub-Saharan Africa, held from today, 16th to 17th in Nairobi here at Pullman Hotels. So the representative of the government of the United Kingdom, I know they may not be physically present here. Oh, wow. Oh, pleasure. I was trying to get my intel, but I missed the executive director and the secretariat of the Global Alliance on Health and Pollution, represented by Maria Paolo, distinguished senior government representative from across Sub-Saharan Africa. I realized I met my colleague from Uganda here, from the Ministry of Health, from NEMA, Ethiopia, and happy to also be engaging in this meeting with colleagues from our National Environment Management Authority, represented by Dr. Tambushi, esteemed representatives of international organizations and development partners. I am happy that we have WHO, Dr. James Dunn. We have representative from UNEP. I may not have known you, and we will be happy to know you during the next 2 days. And the representative of other organizations present here, ladies and gentlemen, good morning. I am reading on behalf of the Cabinet Secretary, so I'll, as I read it from that and understand from that angle. It's my honor and privilege to welcome you all to Nairobi for the Regional Pollution Forum in Sub-Saharan Africa. I extend a warm Kenyan welcome to our delegates who have traveled from across the continent and the globe to join us for this critical dialogue. I want to express my sincere gratitude to the Global Alliance on Health and Pollution, GAHP, for organizing this forum, and to the United Kingdom government, specifically through UK International Development and the Department for Environment, Food and Rural Affairs, Defra, for financing this initiative. Following the successful inaugural meeting in the Asian Regional, which was held in Ho Chi Minh City earlier this year, we are proud that Nairobi is hosting this initial forum in the Sub-Saharan Africa. Distinguished guests, we are gathering at a time when the effects of pollution on climate are evidently exerting immense pressure on our public health infrastructure, public safety, and economic stability across Sub-Saharan Africa and everywhere. Pollution is not merely an environmental hazard. It's a public health emergency that undermines human dignity, strengthens health system, strains health systems, and discriminately impacts vulnerable populations. As we deliberate over the next 2 days, we must confront the reality that environmental degradation directly compromises health outcomes from air quality degradation to the mismanagement of chemicals and hazardous waste. The toll on our population is measurable in both human lives and economic loss. And to effectively safeguard community health, our national and regional climate strategies must seamlessly align with environmental health management and nutrition policies, creating a unified front against these compounding threats. This Sub-Saharan Africa Forum provides a high-level platform for policy dialogue and regional cooperation. And to drive meaningful progress, our discussion must focus heavily on strengthening the science policy interface, ensuring that robust scientific data directly informs actionable public health and environmental policies. We should ensure our regional evidence and priorities feed into and benefit from global guidance and targets. Over the next 1 to 2 days, we are called upon to strengthen regional cooperations across the critical 4 frontiers that this forum is going to be discussing. Air quality management, we are called upon to implement data-driven interventions to reduce ambient and household air pollution, directly mitigating respiratory and cardiovascular disease burdens. We must align our actions with a global roadmap to address the adverse health effects of air pollution while adopting common monitoring standards, setting phased reduction targets, and scaling access to clean household energy and transport solutions. And happy that Kenya is already contributing to this agenda at the global level. Together, and happy that UK is doing this. We co-chair the global WHO REN Secretariat, which is the FOCA, Friends of Clean Air for Health with the UK. And our co-chairing birth this updated roadmap. And so I was the co-chair from Kenya, and we had a colleague from the UK Air Pollution Policy Support. So that was passed in 2025 by the World Health Assembly. And so for us here, what we have done as a country, especially from the health sector, is we have developed and finalized a household air pollution prevention strategy 2024-2029. This is a national blueprint to reduce exposure from cooking, heating, and other household sources through clean energy access, behavior change, and strengthen health sector responses. We work very closely with our counterpart sectors. You've heard of NEMA here, the Minister of Environment, the Minister of Energy, the Minister of Public Works, and all the allied or health determining sectors. Then sound chemical management, by establishing safer, well-regulated framework for chemical use and disposal, we shall prevent toxic exposures in our communities and ecosystems. Our regional framework should also be consistent with evolving global framework on chemicals, strengthening life cycle management, information sharing, and capacity for safe alternatives in emergency responses. For us, happy that we also work very closely across the sectors, between the sector of environment, health, and safety. In health, I represent health at the GFC with the Basel, Rotterdam, and Stockholm Convention as one of the focal point under UNEP. So that shows the level of our coordination, other than the representative or the lead representative from the Ministry of Environment. Also, as we also work to combat plastic pollutions, it's important that we develop sustainable circular economy alternatives to curb the accumulations of plastic waste that continue to threaten our land and marine environment. Regional efforts should leverage international agreements, technical assistance, and finance to move towards use, cycle, and product design changes. And we call upon GAHP here to really continue putting up the pressure because we realize what we did not succeed and still that we have a lot of work to do. Robust waste management, lastly, by strengthening localized and national infrastructure to ensure municipal, industrial, and biomedical waste is managed without compromising public health and safety. Environmental and air quality, our waste management methods should not contribute to further pollution. We must embrace modern technologies and best practice standards while ensuring equitable access to safe services for all communities. As we finalize, as I finalize this, I'm also proud to note that Kenya's proactive investment in capacity and knowledge sharings, and this is also something that the health sector in Kenya is doing together with the UK. The establishment of the Kenya Air Pollution Center of Excellence at Kenya Medical Research Institute is also an important efforts that Kenya has provided and is also sharing for the regional hub for monitoring research, training, and policy support. It will help harmonize measurements, build local technical expertise, and generate the evidence base required to guide intervention not only for Kenya, but for partner countries across the region. Pollution respects no sovereign borders. The government, the environment, and health challenges faced by one nation are invariably shared by its neighbors. Therefore, our commitment must extend far beyond the sessions of this forum, and we must ensure strong alignments with our respective national strategies, priorities, while simultaneously forging a unified regional front. One country may be making strong strides in banning certain plastics or regulating harmful chemicals, but without harmonized regional policy and enforcement. Those gains can be eroded by cross-border trade and informal practice. And to be effective, our regional strategy must be nested with a broader global architecture, which must also include a commitment to the global roadmap on air pollution by adopting clear strategies, alignment with the chemical management with the global framework on chemicals, and also tapping into international financing mechanisms. In that way, we will be enhancing data interoperability and reporting so our progress is visible in global tracking systems and help shape future international commitments. And to conclude, I urge all senior policymakers, decision makers, and technical experts present to actively engage, share best practices, and challenge existing policies. Let us leverage this opportunity to shape a resilient, healthy, and pollution-free future for the Sub-Saharan Africa and the world. We need to commit here to clear time-bound actions that feed into global roadmaps and frameworks so that our regional progress contribute to and benefit from international momentum. It's now my honor to declare the Regional Pollution Forum in Sub-Saharan Africa officially open. I wish you all highly productive deliberations, and thank you very much. Asanteni sana. That's from the Cabinet Secretary, Ministry of Health. Thank you.
Thank you, Mr. Lulem. Now I welcome Dr. Tampushi Leonard.
Hi, good morning, everyone. Good, it's a pleasure to see all of us here seated today. I want to welcome you again to Kenya. The Ololem has already done that. I'm going to be brief because I'm just going to make a keynote address from my Director General, Dr. Mamo Bimamo, from the National Environment Management Authority. Distinguished guests, representatives of governments, colleagues from the international organizations, members of the scientific community, and development partners. The challenge we confront transcends the environmental domains. It is, at its core, a matter of public health, social equity, and sustainable development. According to the Lancet Commission on Pollution and Health, pollution is responsible for approximately 9 million deaths annually. Worldwide, more than AIDS, tuberculosis, and malaria combined together. 90% of these deaths occur in low and middle income countries in Africa. Air pollution alone caused an estimated 1.1 million deaths in 2019, surpassing the combined toll of malaria, HIV, and tuberculosis. In Kenya, for instance, giving us a very suitable example, air pollution alone contributes to over 20,000 premature deaths each year, while exposure on unsafe chemicals, contaminants, contaminated water, and deficient waste management continue to impose considerable strain on national health systems and economics. Exposure to unsafe chemicals, contaminated water, and poor waste management continue to impose a substantial burden on our health systems and also on the economy, both at the national and also at the regional levels. We are also increasingly learning that the impacts of pollution begin long before birth. Research on fetal origins of adult diseases has demonstrated the environmental exposure during pregnancy, which can shape health outcomes across the life course. The world is currently debating on the issue of plastic pollution, but in this scenario, microplastics have now been detected in human placentas, meconium, amniotic fluids, cord blood, breast milk, and also in blood serums. Studies report microplastics in all placental samples tested with an average of 2.70 particles per gram. In one cohort, higher placental microplastics exposure was associated with 1 or 7.7 grams decreased in birth weight. That is in infants. Exposure to toxic chemicals, air pollutants, heavy metals, and endocrine disrupting compounds and other environmental contaminants can influence fetal development, increasing the risk of cardiovascular diseases, diabetes, respiratory illnesses, neurodevelopment disorders, and other chronic conditions later in life. In essence, pollution is not only affecting today's population, it is actually shaping the health prospects of future generations before they are even born. This reality compels us to rethink the growing epidemic of non-communicable diseases, which we often associate with lifestyle factors such as diet, tobacco use, alcohol consumption, and physical inactivity. Yet increasingly, evidence points to a significant environmental footprint of non-communicable diseases. Air pollution caused an estimated of 6.7 million of the 9 million pollution-related deaths annually. I give an example in Asia, which is in India, where PM 2.5 alone pollution led to over 1.7 million deaths in 2022. That's a 38% increase since 2010. Air pollution, toxic chemical exposure, contaminated food chains, hazardous waste, and occupational exposures are important contributors to cancers, cardiovascular diseases, chronic respiratory illnesses, and also metabolic disorders. Environmental health policy is therefore not peripheral to the fight against these kind of diseases or challenges that we face, but it is central to it. The burden of pollution falls disproportionately on those least equipped to bear it, in children, women, informal workers, and low-income communities often experience the greatest exposure while having the fewest resources to mitigate its effect. Globally, household air pollution from solid fuels resulted in an estimated 520,000 premature deaths in Sub-Saharan Africa, and exposure to PM 2.5 was estimated to cause 1.9 billion loss in IQ points in Africa and children in 2019. In this sense, pollution is not only an environmental issue, but also an equity issue. Equally important is the economic dimension of pollution. For too long, pollution has been treated as an externality. The cost of pollution are frequently borne not by those who generate it, but by citizens, communities, and governments. In Africa, it only cost about 14 billion in 2013, equivalent to 3.8% of the region's GDP. The economic loss from premature death due to ambient particulate matter pollution, for instance, in Africa, was approximately 215 billion in 2013, with household air pollution and also adding another 232 billion. In Kenya, premature mortality due to pollution translates to economic loss of up to 9.5% of GDP in some assessments, though country-specific studies for Africa report loss of 1.16% of GDP in Ethiopia, 0.9% in Ghana, 1.19% in Rwanda. Industries may prioritize profits while the public absorb the cost through rising healthcare expenditures, environmental remediation, productivity loss, ecosystem degradation, and reduced quality of life. In effect, taxpayers are often forced to subsidize pollution through public health and environmental consequences they are left to manage. This discussion today is particularly relevant in the context of ongoing global negotiations or legally binding treaties to address pollution, such as plastic pollution, while the international community has made significant progress in recognizing the urgency of the plastic crisis, negotiations have faced considerable challenges and delays. The inability to reach consensus on critical issues, including production limits, chemical, for example, additives, and financing mechanisms, underscore the complexity of balancing economic interest with environmental and public health imperatives. Yet, the cost of inactions continue to rise. Fortunately, we are not without solutions. Across African governments, researchers, civil society organizations, communities, and development partners are demonstrating the progress that is possible. Clean energy technologies, improved waste management systems, strengthening environmental regulations, circular economy approaches, pollution monitoring systems, and community-based interventions are already delivering measurable benefits that requires now in greater scale, stronger coordination and sustainable political commitment. Ladies and gentlemen, I would like to provide for a minute the 3 priorities that deserve our particular attention in this forum. Number 1, first, we must strengthen our environmental governance. Effective laws, regulations, monitoring systems, and enforcement mechanisms remain essentials for reducing pollution and protecting public health. Strong institutions are the foundations upon which lasting environmental progress actually is built. Number 2, we must invest in science, research, and innovation. Evidence-based policy making is critical to understanding pollution pathways, assessing risk, measuring impacts, and identifying effective interventions. The collaborations between the scientists and policymakers represented in this forum is therefore especially very critical. Number 3, we must place communities at the center of our efforts. Sustainable solutions cannot be imposed from above. They must be informed by local realities, driven by local ownership, and designed to improve the lives of ordinary citizens. This forum therefore arrives at a critical moment where the global community are advancing implementation of resolutions on chemicals, waste management, and pollution prevention. At the same time, countries across Africa are developing ambitious strategies to improve environmental health outcomes while pursuing economic growth and industrial development. These objectives are not contradictory. Environmental protection and economic development are mutually reinforcing. A cleaner environment contributes to healthcare population, lower healthcare costs, and also increasing productivity, stronger resilience, and more sustainable growth. This discussion over the next 2 days provide an opportunity to move beyond identifying challenges and towards developing practical, scalable solutions. The expertise gathered in this room represent an extraordinary resource. By sharing experiences, learning from success stories, and also strengthening partnership, we can accelerate progress across the region. The true measure of our success will not be declarations we make or the meeting we convene. It will be whether future generations inherit an environment that promotes health rather than diseases, resilience rather than vulnerability, and prosperity rather than pollution. I wish you a productive deliberation and every success in this forum. Thank you very much.
Thank you, Dr. Leonard. Now it's our great pleasure to welcome Ms. Tox Akinsheye from the UK government.
Good morning. Good morning, everyone. And to all colleagues from different government departments represented here and the senior government officials, thank you for being here. So my name is Tokes Akinsheye, and I'm from the UK Department for Environment, Food and Rural Affairs. I am the head of the Environmental Quality International team. And it is my pleasure to join you today in Nairobi to deliver the first Sub-Saharan African Regional Pollution Forum. I consider it a great privilege to gather here over the next 2 days with colleagues from government, from the NGOs, from academic institutions, and the international organizations, all united by a shared purpose to confront pollution as the transboundary challenge that it is. This forum represents a new chapter in international collaboration. And as a UK government-led initiative coordinated by Defra, the Regional Pollution Forum is designed to bring together partners across Sub-Saharan Africa to build solutions that strengthen environmental sustainability and public health across the region. Our mission is clear. Pollution, whether from air, chemicals, waste, or plastics, does not respect borders. Its impact cuts across sectors, geographies, and generations. And that is why regional cooperation is essential. Through these forums, we will focus on targeted capacity building, enabling technical experts and policymakers to strengthen their approaches, share best practices, and access international funding that can turn plans into action. Today marks the first edition of the forum, but our hope is that this is only the beginning. The relationships formed here, the insights shared, and the collaborations sparked have the potential to drive real improvements. Cleaner air, safer communities, healthier ecosystems, and more resilient futures. So, thank you for being part of this important initiative. Your commitment, your experience, and your leadership are what is going to make this work possible. A particular thanks to our delivery partners, the Global Alliance on Health and Pollution, GAHP, who have worked hard to deliver this ambitious agenda and respond to evolving challenges. It is really encouraging to see the turnout, despite the challenges that we've had in getting here. And I look forward to the 2 days or 1.5 days ahead, working together to create a cleaner, healthier, and more sustainable future. Welcome, everybody, and thank you.
Thank you, Mrs. Stokes, and thank you to all of the speakers. You were wonderful, and now we would like to begin with the first session. I know we started a bit late, but we will try to catch up with the program. So we will now have the first session moderated by Raymond Rioka, who's a GAHP board member. And in this session, they will examine environmental health challenges, priority interventions, and best practices from global perspectives. The panelists come from international organizations, so you will hear a wide range of perspective on pollution management. Mr. Rioka, this is yours.
Thank you very much, Anna. Good morning. Good morning. I know it's a cold morning, but we're going to get something warm later on. Once again, I'm called Raymond Rioka. I am a GAHP board member from Uganda, under Yadinet and Arch Africa, and we are honored to be in Nairobi. I'm here for this wonderful session, which we know will be very informative, educative for all of us. I have a number of panelists whom I'm going to invite here to give the experience in relation to pollution. That said, as we begin our discussion on environmental health change in Sub-Saharan Africa, join me to welcome our first speaker, Ms. Maria Paula Lea, the Executive Director of Global Alliance on Health and Pollution, to give us perspective from the regional forum. Let's clap hands as we welcome Maria. Thank you. Over to you, Maria.
Thank you, Raymond. And thanks to all of you. I have slides, and I hope we'll be quick because we have a lot of interesting presentation, but I wanted to start with presenting who we are, because I have the pleasure and privilege to know many of you, but some of you do not know GAHP yet. And also I want to explain how we landed here, why we are doing this, and where this is started from. And I think then I will invite also Tox or Alice to join me, because of course, this is a shared effort which has been driven by the UK. And I think it's very important that they are here with me. Can we move the screen and start with the slides? Yeah, can you see, can the online participants see the slides? Because we can't. Well, I'll get started in the interest of time, explaining what GAHP is about. And then as soon as we get the slides, it should be less monotone, because I think it's always nice when you have some background information. And maybe, Sophia, you can call Brian in the meantime, who should be here to make sure we have the slides. So the Global Alliance on Health and Pollution is a Swiss foundation based in Geneva, Switzerland. And we are focusing on advocacy and awareness raising and providing specific country support. So this is how we operate quickly. I sit in the secretariat, of which I'm the executive director, and we are based in Geneva, but we are truly a global alliance. And as you see, members of my team from Mali, US, from Latin America, from Uganda, from Vietnam. So we're very truly a global team, working across many members and with countries. And we have the privilege of having many members and part of this country sitting in a mechanism called council. And here today I have the privilege to host some of our council members coming from Uganda and representing NEMA and also the Ministry of Environment in Uganda, for example. But we also have other members like UNEP, for example, and they also are here with us today, or the World Bank, who is also with us. And the mandate that the Secretariat received to operate is given by the board, which is comprised of a number of fantastic individuals. And I have the honor to have some of them today with us. One is Raymond Rioka, one is John Pamela, one sitting at the end from Ghana, and the other one is George from Ivory Coast. Thank you very much. And they represent different constituencies, different countries. They have very different expertise. They're experts in human rights, in environmental law, in pollution management, sitting across the globe, because we need that unique and diverse perspective, because we are trying to address huge issue here, pollution. Why do we focus on pollution? And I don't have to be long, because NEMA already and WHO explain us that more than 9 million deaths caused every year are caused by pollution, causing threats to our health and impacting especially low and middle income countries, which is why we're here today. 92% of those 9 million deaths, unfortunately, occur in low and middle income countries. And so why do we focus on this? And why do we struggle to get here? And we are so privileged to have the support of people like the UK and many others development partners. Because as you know, even though those figures are much higher than diseases like TB, HIV, malaria overall, which are well-known infectious diseases, and we should continue to invest in those. The investment in pollution is very limited, is very little, despite the huge challenges we are facing and the high number of deaths. So this is why we put our efforts, and this is part of our mission, linking health and pollution. What are the priority issues we have to look into? And so we started as a collaborative alliance. We have about 35 countries and overall more than 70 members, including some of those that I just mentioned. And we were able to convene our main program, which is the Health Pollution Action Plan in more than 14 countries, launch a number of scientific publications, because I guess we heard from NEMA and WHO the importance of sharing data and making a decision-informed processes to make sure that, you know, policy can really have that approach and be strengthened by data. We also have UNIA observer status, which means that, you know, we participate in many UN processes. We are part of different expert working groups, for example. Next week, there will be the open-ended working group with the Basel Convention, during which we will have a side event. We sit in different of this meeting, linked to indicators, linked to use lead-acid batteries. So we walk across a variety of numbers of topics, always the scope of looking at putting health on the top. And of course, we have been instrumental in achieving also high ambitious targets, like participating to put the 3.9 target by 2030 in the SDGs, and we work a lot on advocacy. And there is an effort, which I will mention, which we had last year, specifically addressing lead pollution. So the two main areas of focus, as I mentioned, are advocacy at different levels, starting from international effort and regional effort like this one, to make sure we put pollution at the center of our effort. Also raising awareness with communities, because we know the importance of working with local people and the people on the ground to make sure that those policies that sometimes cannot be enforced do not remain abstract, but are translated with simple local action to have an impact. And at the same time, we work with countries. And when I say we work with countries, of course, we have a lot of limits linked to funds and resources. This is why I try also to make sure that countries know that this should be a priority. But we vehiculate funds and resources as much as possible to make sure we support countries strengthen their capacities and partnering with them to achieve their priority, looking always at health at the center. This is some of our effort linked to global advocacy, and you see us a lot in UNEP processes and UNIA processes. Last year also we participated in the new science policy panel, which has been established to address chemicals, waste, and pollution, and we presented a conference room paper on lead as an issue of concern, with the support of countries like Uganda, I'm very proud of that, Uruguay, Nigeria, Paraguay, and Mexico. And this year, this conference room paper will be presented at the international conference, which puts, you know, lead as a priority issue for us. And of course, we should be looking at all the spectrum of chemicals and see what it makes sense. But our position is to make sure that we recognize the main sources of lead contamination, looking at it overall. And I want to mention this specifically because we can still have country and organization support to make sure that, you know, others join forces to nominate lead as an issue of concern. So if there is any interest in this room, I mean, I will be happy to talk to you afterwards. Briefly here, you see, you know, that we have been running with the UK, with the support of Defra, an environmental pollution program, both in Vietnam, in Asia, and in Uganda from 2022 till March 2026, which developing an health and pollution action plan, looking at how to strengthen our quality system, looking also how to carry out research and economic analysis to show what is the cost of inaction in a country, and working with the civil society organization. And we have also our programs. We are implementing partner of UNEP through grant co-financed by European Union, working on lead, specifically on ULABs, use lead-acid batteries. And that touches a lot of policy concern linked to UNEP. And we are trying to produce a technical report on global policy option for lead contamination reduction, which will be available. And here you see the number of countries where we have been convening an health and pollution action plan. So why we are landing here now in Kenya? I mean, as I said, you know, we work to an environmental pollution program in Uganda and in Vietnam. And when we realized the impact we were achieving through the program, we soon thought, with the support of the UK, that it made a lot of sense to spread that impact across the region and establish collaborative efforts, which will go beyond a country program. And so we launched the Regional Pollution Forum in Vietnam in March, and we were going to host it in Uganda in June. And of course, due to recent health challenges in the region, we didn't want to put an additional burden on the country. And we had the privilege and we were lucky to be hosted in Kenya. Thanks a lot to all of you. Thanks to NEMA, to MOH, to my coordinator, UNEP, and all the ones that help us to put this together. Again, we wanted to see how can we go beyond implementing a program? How can we connect, you know, countries, because you're already doing a lot of things. And sometimes, you know, the information sharing, the alignment of policy can just help reaching much more broader impact. And so that is basically the purpose of the forum. What are the responses to pollution linked to air, waste, plastics? What are you going to do? What are you doing already? What are the best practices in the region? What are the approaches that we can use? And how can we move from those policy and those theory to implementing? So that's why we're here together, and we invited a wide range of people, which all of you have a technical background and expertise, so that we can try to be practical. And so encourage that innovation that we hear, it's important to have, and that technology, which means also bringing the private sector, you know, bringing, you know, the new investment that we need, including gender, equity, social inclusion across all the things we do, because we know that pollution impacts the vulnerable more than everyone else. And so this goes with knowledge exchange and of course, health intervention practice. And then also looking at the UK expertise and country expertise, but also what are the available financing mechanisms which are already going on in Sub-Saharan Africa. And so we will be having a session hosted with the World Bank and UNEP, looking at the special programs, looking at already what is going on. And I really invite you to think and to challenge them and yourself, saying what my country can do, how I can leverage those platforms, and how can we work collaboratively? Because sometimes, you know, mechanisms exist, and I hear very often that they're not fully utilized because maybe countries do not know how to respond to that program or how to apply, or, you know, what makes sense for them. But I ask you, what does it make sense for you? What does it make sense for the region? Let's talk to them. So we wanted to go through a coordinated approach to make sure we land the discussion. And before I walk you through this, we established a coordinating mechanism with GAHP, which of course was tested already in Vietnam, because we launched the forum first in Vietnam. And we had a number of consultations online before we put the forum together to make sure we heard from you and from others on what is your interest? What are you interested in? What do you want to see happening during the forum? What does it make sense? How should we work together? And then develop a structure and teams for the working groups. And so you will see that later on, after the session, after presentation, we will break up in working groups, because we want to hear those challenges that you have in common, but also those solutions. You know, what can work in your country? What did it work that we can replicate? So those were the takeaway of those consultations. We launched more than 300 surveys online to make sure that our thoughts align with the needs, and that was not, you know, there was a shared intent rather than bottom-down approach. And so the team that have been identified are looking at financing, political commitment. Of course, air pollution is always very priority agenda, but also monitoring data system, policy, waste management. But again, today we will work with you to see what does it make sense for you. And also, of course, we are aware that we launched this forum for Sub-Saharan Africa, but Africa is very big, right? What it makes sense here, it doesn't make the same sense in Senegal. And the language and the culture you have, of course, is different, is so rich. So I think we have to challenge ourselves is that even though we will have a product today or tomorrow at the end of this forum, that doesn't serve the whole continent, right? We should probably look at replicating this effort in the other part of Africa as well. But let's start nevertheless. And so we want to also get your feedback. So this is why by the end of the day, we will be asking you those questions. You will be asked to vote, to put your input on, what type of content should be emphasized? Which topic should prioritize if we were going to do a next forum? Which stakeholder we should be inviting? Which countries we should prioritize in for participation? We now try to look at neighboring countries. And of course, our focus was Uganda. So we tried to look at Kenya, Tanzania, all the neighboring countries. But we know pollution knows no borders. So how can you work more effectively? What are our partners? And then how we should work in between forums. Should we be looking at working groups? What is the wish? What is the format of the forum? We are now hosting an hybrid configuration because we wanted to be inclusive and ensure that those people that can travel can still attend online. But we all know that coming together in person is different, but we want to hear from you what you think. And then the mechanism for hosting future forum. Is there any countries that want to be leading the next forum? Is there any of you that think that this is important and we can work together to make it happen? Because again, I want to think that we are the convener, as very often happens, of a process, but this process must be owned by countries, otherwise it has no meaning and no future. And so what is the type of support that will be most useful to you, and any other suggestion you might have? So by scanning this, and I don't know whether we will do this or later, we can do this later, but by scanning this QR code, you will see all these questions, and I really invite you to reply. And I don't know if Alice and Tox would like to add anything before we move to the next presentation.
I think I was going to say, to leave the questions. Thank you very much, Maria. Yeah, so I won't keep you very long. I think, we've heard it all through the keynote speeches, the opening remarks, and, from the wonderful presentation from Maria Paula, from the Chief Executive of GAHP. So I think, everyone back a little bit to why Defra, why did we decide to do this? Why did we develop the policy? Why are we funding it? The UK is a country, party member to the UN's Basel, Rotterdam, Stockholm, and Minamata conventions, and to the Global Framework on Chemicals and the recently established Science Policy Panel. All these, the conventions and those frameworks exist to tackle environmental pollution, chemicals, waste, and chemicals and waste pollution mainly. The UK is very committed to its obligations under those conventions and framework. And we're also committed to supporting other countries in their effort to tackle pollution and, and in their effort to also comply, because those conventions come with obligations, that countries have to comply with. So, the UK, we're very passionate that, all countries, including ourselves, that we putting our best foot forward in tackling environmental pollution. So this regional pollution forum has come on the back of the environmental pollution program, which, sadly has come to an end. The environmental pollution program is program that was again developed and funded by Defra, working with delivery partners in GAHP and GNCC, which is the Joint Nature Conservation Committee in Southeast Asia and Sub-Saharan Africa. So Maria mentioned Vietnam. We worked in Vietnam. In Sub-Saharan Africa, we worked in South Africa and Uganda recently. And the whole idea of that program, again, was, to sort of support countries in tackling, the different forms of pollution. And we then, birthed this policy for the forum, given that the environmental pollution program has come to an end. It came to an end on the 31st of March. And we thought, how do we ensure that, all the successes that we had from the program is going to carry on, the legacy is going to be continued in some way or the other. And, how best can that be achieved? And we came up with this Regional Pollution Forum idea, where the lessons that we've learned from working in Vietnam, in South Africa and Uganda can be shared with the neighboring countries, because as GAHP has said, pollution is a transboundary issue. It doesn't stop in one country. It does affect all the neighboring countries. So if we can bring, countries together in a region to talk about what their issues are, for them to identify solutions and, look at working together to resolve those issues, that would be brilliant. But we know that this cannot happen without, further help, support, financial help. So, which is why, again, as part of the Regional Pollution Forum, we've got UNEP here to come and sort of talk to everyone about what funding opportunities are available. And GAHP also, we're able to get in the World Bank. So hopefully, having those conversations with those organizations would really help. Because it is important for us as the UK government that, this continues in the future, it sustains itself. And, we hope that, the funding opportunities available would help, to sort of tackle any financial issues. Maria Paula has asked all the difficult questions. That's why I said, let's leave it up there. This is the opportunity to sort of come together, have those difficult conversations, identify what the priority regional issues are, and identify scalable solutions, and how funding can be accessed. So, looking forward to the next couple of days where these discussions will be had. Thank you very much.
Another round of applause to Prof. and Marie. Thank you very much for the wonderful presentations. As of course, as mentioned, we're here to get together to ensure that it has answered those questions together for all of us. As we move, I wish to call another presenter from UN Environment Program. This is Christina Maria Zuka, who is Global Coordinator, Industry and Economy Division under UNEP. So kindly, let's approach Christina as she joins us here. You're welcome, Christine. Yeah.
Thank you very much. My role, as mentioned in UNEP, is as coordinator of our global program on chemicals and pollution action. We actually call it sub-program. The organization, from a programmatic perspective, works on 7 interconnected sub-programs, and chemicals and pollution action is one of them. Let me see if I can operate this. Yes. Okay, so I'm very glad that basically the previous speakers, they all mentioned the fact that pollution is not just an environmental issue. It is also, of course, a health issue. This is why we are here. But it's even more than that. It's an economic issue, it's a development issue. And I would like to go through a little bit more in depth on these aspects. Maybe though, I just want to say that even if there is growing recognition of this connection between pollution and basically the SDGs, the whole Sustainable Development Agenda, we still are not at the level where there is enough investment. So it's not only funding, directly like ODA, but it's generally investment from private and public entities, recognizing that investing in action is better in economic terms than waiting for the problems to happen and then having to recover and find solutions afterwards. For example, the UN Sustainable Development Frameworks at national level very seldom recognize pollution as a priority, which is very different from climate, which luckily has been mainstreamed in the majority of national plans. I'm talking particularly those supported by the UN, and biodiversity is a bit in between. Might have gone, sorry. Okay, so we heard a lot about health connection, and I'm very happy to hear that Cabinet Secretary has given messages that are from health that are very strongly supporting the importance of the environment as a factor, as a key factor for health. And we have seen two very major recognitions, in my view, of this at the level of UN General Assembly. 2 years ago, we had a resolution resulting from a high-level meeting on antimicrobial resistance, which is typically seen as a health issue. It is a health issue. It's a huge global health threat. But more and more, we recognize that environment is a condition for this problem to emerge and spread. And some of the elements that are very key to be addressed in this context are sustainable consumption and production of antimicrobials, waste management, wastewater management, and action, of course, needs to be across sectors, including agriculture, food sector, veterinary health, environmental sectors. UNEA has recently, the UN Environment Assembly has recently issued a resolution following previous ones, but this is quite strongly referring to the environmental dimensions of antimicrobial resistance. And then last year at UNGA again, UN General Assembly, at the high-level meeting on non-communicable diseases, mental health and well-being, there was a political declaration that resulting in a resolution which very strongly recognized the role of pollution. So air pollution is formally recognized as one of the 5 main modifiable risks for this category of diseases, which is huge. And then also identify specific action. Maybe I don't need to go through it, but it's interesting that it addresses not only air pollution, but the broader chemical pollution agenda, including, for example, highly hazardous pesticides in the context of preventing suicide, as this is one of the, unfortunately, very widely used methods. Oops. Oh, sorry. Sorry, I clicked on the wrong thing. Maybe I can continue in the meantime. Okay, perfect. Sorry. Yes, so the economic aspect. If we invest in pollution prevention, we are enhancing productivity because people are able to work. They are not able to work if they are sick. We enhance the potential for current and future generations. Pollution has a huge toll on child development. We often talk about lead, that's not the only one, including brain IQ issues and also reproductive health. We can create new jobs in many fields, including repairing, recycling, remanufacturing, and waste management. We already have a lot of informal engagement, informal sector engagement, but it can be improved also to improve livelihoods and rights of workers. It's an opportunity in general for innovation, and also it can enhance competitiveness and access to markets worldwide. Food security, we don't maybe talk about it a lot. Air pollution can impact crop yields, so reducing it improves our productivity. The better sustainable management of nutrients, including nitrogen, is a factor for reducing pollution and improving, again, food security. Food safety from reduced contamination, water quality and safety as well. And then in general, it can be an opportunity to promote more sustainable and resilient practices in agriculture. It's important to think, at least from UNEP perspective, we always look at the source. So yes, we need to address pollution when it's there, but we also need to try and move upstream. And so this scheme, I'm not going through it in detail, but it's trying to show how in order to harmful chemicals and pollution, which is the reason why we are working on this, we need to address certain key sectors. We need to address the economy. We need to have a life cycle approach. And there are some sectors and value chains that are particularly important. This reflects what UNEP does, but I think it can also be an input more generally. For example, mining is a very key sector, especially now with the transition to renewable energy, digitalization. The access to critical minerals is becoming more and more necessary, but also there are possible repercussions in terms of pollution and many other environmental spillovers. Plastics, textiles, mobility, electronics as well. Electronics is a very growing, sector, and yet there are many impacts, but also many opportunities to think in a circular manner. So yes, we need to look for more circular approaches. We have some specific approaches, such as a standard producer responsibility, which help think life cycle. We need to think about safer alternatives, product design, so that we go back to the beginning of when a product is being thought of and designed, and until then the end where it becomes possible waste. We have many global agreements and frameworks. I will go a little bit through them later. And then, of course, the enabling aspects, which are not necessarily only specific to pollution, but, having the necessary financing, the trade and fiscal policies, in general, the legislation, having the science and so on, are important enablers for progress. So a little bit more on this. Of course, this is from the global perspective. There are many existing frameworks for action, for providing science, but maybe I just want to focus on something that has been mentioned already, Intergovernmental Science Policy Panel on Chemicals, Waste and Pollution. This is a very important development. And indeed, while we say, that there hasn't been enough investment in pollution, there are many important developments, and this is one of them. We have the IPCC dealing with climate, we have IPBES dealing with ecosystems. Now, finally, we have something at the same level addressing chemicals, waste, and pollution, which will inform action at all levels. We're still in the making, but I think we have already made huge steps ahead. And then, of course, we have MEAs, we have several frameworks, including the global framework on chemicals, which I will talk about a bit more. And we also have global and regional networks. And I'm glad I was hearing, for example, action on air pollution at national, regional level. And for example, for air pollution, we have regional networks in different regions, including in Africa, with support from the Climate and Clean Air Coalition, which UNEP hosts. Okay, a bit more on the global framework on chemicals. I heard various participants being actively part of this. This is a multi-stakeholder and multi-sectoral framework for safe and sustainable management of chemicals and waste, which was adopted in 2023. It is the successor of what we used to call CICAM. It has 5 strategic objectives and 28 targets associated with the strategic objectives. So the idea is to make progress towards these sets of goals. Here is an overview of the strategic objectives. The first one is about legal frameworks and capacities. The second one is about knowledge and science and data. Then we have issues of concern. This has been mentioned already by GAHP, for example, having presented a new proposal for issues of concern to complement existing ones. Then we have safer alternatives. So this is dealing with product and value chains, as I mentioned, and then on basically on finance and enabling conditions. There are several implementation mechanisms, but I want to highlight the implementation programs, which we are working on through a set of organizations organized as IOMC. So for now, we're focusing on 2. One is on legal and policies and institutional capacities, and the second one is on economic and industry sector engagement. And under these, we have active work happening on electronics, textile, healthcare, and buildings and construction. So actually, these are open for participation by key stakeholders, and the idea is to advance action through collaboration, and specific work plans are being developed. The first international conference of this framework is planned for later this year in November, and it will look at implementation arrangements, as I mentioned, focusing on those implementation programs, but also on tracking progress. So a set of indicators are being developed, including at the high level to look at the burden of disease, but also which is already developed from the health sector, but also the more environmental burden. And as I mentioned, this is like multi-stakeholder, and I think many here are probably aware and maybe already part of this. Now, finally, very briefly, you know, African countries are going through huge development, urbanization, industrialization, expansion of the mining sector, of agriculture sector, and there is an opportunity while, you know, going in this direction of development to think about how can we maybe skip some of the pollution traps, you know, that can be skipped maybe by leapfrogging somehow to more circular prevention at source approaches. And important aspects of this include regulatory approaches, which can be very complex, but there could be ways to maybe simplify. In UNEP, we're working on some work on that, some guidance on that. Engaging with industry because of this possibility of innovation and, you know, transformation in key sectors, so that also market access can be improved, jobs and growth opportunity. Important to recognize the benefits of action. There are studies, and more studies are being done to be very specific. What does it cost, you know, to not act, and what can we save from acting early? And which should be the basis for increasing investment. And then finally, the opportunity to engage in global frameworks, such as the Global Framework on Chemicals, but there are many more, such as also the you know, air quality networks and many alliances that are already in existing, but also developing, for example, also on highly hazardous pesticides, which is also one of the things that will be discussed at the International Conference of the Global Framework on Chemicals. And I will stop here. I thank you very much.
Another round of applause to Christina for the great work done. Join this panel there. The great work done by UNEP. The other panelist we have to listen to is Dr. James Dan Otieno, who is a national professional officer, malaria epidemics and focal point, climate change and health at WHO Country Office, Nairobi here in Kenya. Welcome, Dr. James, to the podium.
So good morning, ladies and gentlemen. Yeah, so I'll limit myself to environmental health challenges, priority interventions, and the lessons or best practices. Yeah, I had to admit that climate change and health is a new area for me, but I'll do my best to be able to present some objective assessment based on the readings as well as WHO guidance in this area. So that's the outline of my presentation. So I'll limit myself to mandates and frameworks, WHO mandates and frameworks, and the regional focus, why we handle this pollution under the climate change agenda, the regional strategy, the pollution as a planetary threat, as well as challenges and gaps, and maybe lessons and recommendations. So I'll start with our mandate as WHO at the regional office. We work under several international as well as regional frameworks. The first one being the Global Program of Work, GPW 14. That is what drives the work of WHO globally as well as regionally. Secondly, we have a framework for climate resilient and sustainable health systems, followed by a regional strategy for managing environmental determinants of health, RC72. The WHO 78th World Health Assembly, the Global Action Plan on Climate Change and Health, the SDG goals 13 as well as the SDG goal 3. So this presentation will be available, so don't worry so much about writing. When we look at climate change, WHO developed an operational framework for climate resilient and low carbon health systems. And this is the framework. It basically gives a health systems approach to ensuring that all areas of a health system are taken care of with regards to climate change, reduction of the impacts of climate change. It means that you have to work through all these health system blocks to be able to ensure your specific mitigation or adaptation measures address the specific health system. And with that, at the end of it all, you'll have a very vibrant health system that is climate resilient. So these are the details, and I've specifically bolded those that are relevant to pollution as well as the kind of what we are discussing today. One, you realize number 3. Number 2 is a health workforce. Number 3 is assessment within climate health and the climate, especially the health risks, as well as the GHG emissions. We are talking about risks monitoring, early warning systems, and GHG emission tracking. We talk about management of environmental determinants of health, as well as health financing. So all this is basically amplified within air pollution and those specific frameworks and guidance that WHO provides. So maybe this is just the way the specific areas that WHO concentrates in lead to the SDG 13 climate action. At the base, you can see climate change and health. There's air pollution, energy, wash, as well as chemical safety. So these are basically the regional priority areas. I'll not take so much time on them. And specifically, if you look at the technical portfolios, we talk about climate change and health, wash, chemical safety, and air pollution. So why does WHO and the world look at climate change as something that's urgent for the region of Africa? One is the fact that in terms of the data, 56% of the public health emergencies are as a result of climate change. We have global greenhouse gas emissions, and we only contribute less than 4%. And yet we are the continent which has got one of the greatest challenges with regards to mortalities as well as the effects of climate health, adverse climate health exposure. When you look at premature deaths, we contribute around over 800,000, and there are 100 billion people whose health systems we are strengthening so that we can be able to be resilient to the hazards of climate change. So climate change, based on vulnerabilities, which are individual as well as context specific and in terms of locality, leads to a number of challenges. And we have climate-related hazards, whether they are heat, sea level, air pollution we're discussing today. And all this lead to specific health outcomes, poor health outcomes in various body systems. So when we talk about the environmental determinants of health, we are looking at this scope where we're talking about those which affect air pollution, within the air pollution, the freshwater and ocean pollution, as well as the pollution of the landmass. And therefore, I'll articulate those within the air pollution as fine particulate matter, less than 2.5 micrometers. And we know that the air pollution, especially fine particulate matter, most of it is due to ambient air pollution, as well as household air pollution. When in other words, the other contributors include the ozone, oxides of sulfur, and nitrogen dioxide. When we look at the freshwater or oceans, we are looking at unsafe sanitation and unsafe water sources as a big area of pollution, especially with regards to environmental pollution. We are looking at heavy metals, mercury, and a very big area that is coming up in the recent past is plastic waste pollution as part of the freshwater and ocean pollutions. And finally, the pollution which is associated with the landmass, for example, lead, which is a big thing, as one of the speakers has just talked about. Then we're talking about agricultural pesticides and industrial chemicals. So this is basically pollution in numbers. I'll not spend so much time for this, but I want to say that based on a Lancet review that was done in a report that was presented in 2017, they say that the triad of pollution, climate change, and biodiversity issues of our time currently. So in other words, we have to make investments in pollution, climate change, and biodiversity. And I also would want us to revolve around those key areas as we discuss what pollution is and how it affects us. WHO produces several global guidances, and one important one was the Regional Committee number 72, the Regional Strategy for Managing Environmental Determinants of Health. And this provides a comprehensive 10-year framework, which talks about health and environmental interventions across the component. It focuses on safely managed drinking water, safe sanitation, air pollution, sound management, chemical and waste, climate change adaptation and resilience, as well as vector control. These are specific aims and objectives, and I think we can read much about that. But what is important for me today was to discuss the challenges that we have with regards to environmental determinants of health and its and how it affects us. One, we have realized that a lot of financing is available. However, there are serious challenges with regards of accessing this finance. For example, I'll give you an example. There's something called the Adaptation Fund. The Adaptation Fund supports countries to be able to adapt or roll out mitigation measures for climate change. However, you would spend 3 to 5 years, up to 3 years writing a proposal, including it being endorsed, for you to be able to ensure that you implement the activities that are related to climate change, as well as environmental degradation, measures to reduce environmental degradation. I think this is a big challenge, especially for us for us people in health and working on environmental health. Secondly, some of these funding is given out in terms of debt instruments, and some of these debt instruments, when you're giving debt instruments to an already overburdened country to be able to resolve its climate issues, and I think that is a wrong approach. The other thing is that out of this financing, you find that several countries, it's only a few of those countries which actually access that fund. Why? Because they have the technical capacity to do that. All those people who actually need it, in terms of the countries that actually need it, do not actually get it, because of the fact that, one, either they submitted the proposal late, or two, they didn't have the technical capacity to be able to attract that funding. So finance is a challenge, a big challenge for us, especially in air pollution and environmental determinants of it. Secondly, we will talk about challenges in capacity. And capacity is a big issue in terms of all the countries that actually suffer the hazards of climate change. And I think this is one of the areas that, as advocates and as scientists, we should be able to work on, to be able to ensure that we are well prepared to be able to access that kind of funding, as well as any other technical assistance. The second thing that we want to talk about as a challenge is governance, leadership, and policies. One of the major challenges that we are actually faced with right now, for example, in Africa and in countries, is the fact that the sectors between health, finance, environment, agriculture, they don't actually work together. In fact, if they work together, you find that there's a lot of push and pull with regards to control the resources. Actually, resources tear apart people. I don't know, money tears marriages, money tears friendships, and also money tears intersectoral collaboration. And so this is a very big challenge, and one of the gaps that will need to be addressed for us to be able to ensure that we do well in terms of environmental determinants of health and air pollution. We also have within that policies, for example. Some of those policies are sound. However, when it comes to translation of those policies from policy into specific activities that actually should be able to drive your air pollution agenda, then you find that process becomes so slow. And in fact, sometimes those interventions do not actually reach the subnational level where they should actually make a big impact. And I think that is something, that policy translation aspect should actually be considered as a gap. The other thing is in terms of leadership. We do have, for example, institutional arrangements and coordination mechanisms that are actually been vouched for by the specific global guidance as well as WHO guidance. However, some of these coordination structures do not actually work across all the levels. Sometimes you find that there's even to be able to meet because, for example, funding is little. So whether there's funding or not, maybe people should be able to have a shared vision so that you can be able to move forward. I think the third area and challenge is knowledge and data sharing, as well as monitoring systems, especially with regards to climate change and health metrics. So there are very many poor data sharing mechanisms. We don't have strong mechanisms for data sharing, even within countries. For example, the meteorology department does not coordinate its sharing of information with the disease-specific sector units, as well as environmental health units. Secondly, there may all be suboptimal systems. For example, we do not have very robust air pollution monitoring systems across countries. We do not have well-capacitated prison centers within countries. Yet all these have actually been vouched for by the specific global guidance. Finally, my last slide. Maybe these are the recommendations. And one, we look at the policy frameworks. We strengthen this, especially as well as institutional sectoral mechanisms and collaborations. Secondly, we look at the building the infrastructural, technical, and institutional capacities within specific countries. We scale up effective primary care intervention. Primary care interventions include the wash, air pollution, cleanage, chemicals, and waste management, because all these are primary care interventions that actually address environmental determinants of health and pollution. The third thing we do is financing, ensure sustainable financing. Let us simplify access as well as the timelines and ensure there's equity. Include monitoring as well as especially work within WHO framework to be able to provide guidance to countries. Thank you very much.
Another round of applause for Dr. Dan for the great submission. Can they join the panel on the right? We are now ready for Q&A and questions that we have for the panelists, based on the discussions I've had for us this morning. Before that, but I have a question for each of you in relation to the discussion that we have, starting with Maria Paula. Yeah, from your perspective as GAHP, I know you have highlighted it in the presentation. What should be done to reduce mortalities? You have heard from the minister, from the cabinet secretary, of the 9 million deaths globally, and more than 6.9 million emanate from air pollution. And Kenya has more than 200,000 deaths emanating from this. What's your perspective in relation to addressing these challenges, mortalities? Thank you. Your mic on, put the mic on. Thank you.
Thank you. GAHP perspective is, as always, the same approach wherever we go, which is looking at multi-stakeholder engagement, because as we heard, this challenge is very big. We have to look at industrial process. We have to look at roles and responsibility and investment. So making sure that everyone is involved in the agenda, in the solution. And then also looking at what are the highest impact that can produce the intervention. So we all know that, the challenges are plenty, but what does produce most of the impact? And I think, this talks about how can we support prioritizing and then strengthening technical capacity. And I think, we saw that there is a lot of knowledge, there are a lot of expertise and experts in this region. And sometimes it's just a matter on how do we reinforce that, or how do we connect certain dots. So I think I want to put this at the center so that we reach the goal of really looking at sustainable by design, rather than talking like how can we recycle or how can we, solve a problem. It's like, how do we plan right together? Thank you.
Thank you very much, Maria, and thank you, GAHP, for great work. Christina, from your presentation, doing great work, and you have brought a case on the challenges that are happening emanating from pollution. As we come to 2030 agenda, the next 5 years, from perspective as UNEP, how do you achieve these measurable results to ensure that the reduction in pollution-related impacts to the health? Thank you.
Thank you. Yes, indeed, our strategy is looking at 2030 as our kind of landing point. And maybe I can just go back to some of the things that I said during the presentation. I think something very important is to look at the policies that we have, and of course, the implementation of these policies, and how they can facilitate a shift to really change the way that we do things, like this sustainable by design that Maria Paula said. How do we go with the sustainable by design approach in the way, for example, that we produce, commercialize, and products, right? So, for example, the one interesting policy is the one that could facilitate we call it extended producer responsibility, or wider, schemes for reuse, return schemes, and so on. because they can really put the emphasis both on the fact that there is a specific responsibility, a sort of a pollution-based principle, type of responsibility across the value chain. And also it can bring attention to the higher, like the beginning, let's say, of the design of products. Similarly, if citizens, users, consumers know what is in their products, they can make better choices. So there is also a growing interest in making the presence of toxic chemicals more visible. So it's not just about what happens in the environment, which of course is very important, the pollution of our environment, but it's also what is the content of our food, what is in the water that we drink, and also how can the products that we use have an impact directly in our life. So shifting a little bit from addressing specific chemicals, specific pollutant, to thinking more as a system, like, so how can we go back to the drawing board in a way and make sure that what ends up in the market and the way we do things is sustainable by design.
Thank you very much, Christina. Dr. Dan, you've heard from talking about the consumer knowledge gaps, especially on toxicity and pollution-related agents. From the WHO point of view, what can be done to reduce the pollution exposure, especially in relation to health?
Yeah, thank you very much. So reduction of pollution exposure from the health perspective involves a lot of specific areas that we need to address. One of the biggest areas that we need to address is policy development and implementation. And this will be able to look at all the specific actors within the air pollution sectors. I think development of our policies have to be as broad as possible to include all the actors so that we come up with a very sensitive policy that can be able to address our challenges. Secondly, we must be able to adhere by standards and regulations within those policies for everyone. We don't have the issue of 2 legs better, 4 legs better. Everyone must be accountable to the same standards, whether you're a manufacturer, whether you're an exporter, or whether you are within the health sector or out of the wealth in the energy sector. All of us must have a specific united vision to be able to reduce mortalities and the specific health impacts that pollution actually produces in the human race. Then the other thing is the fact that in order for us to be able to reduce pollution, we have to adhere by the global standards and normative guidance that are provided by specific organizations, WHO included. I'll go a little bit further. It should be a lot of multi-sectoral collaboration within this, and by collaboration, sectoral collaboration, sustainability by design. The Ministry of Energy must have a shared vision within health. They need to know that when we allow specific vehicles to come into the country, vehicles that are roadworthy, vehicles that do not emit a lot of greenhouse gases, then by that we'll be contributing to a higher vision, which is within health. When a policy touches on, for example, transitioning to clean energy, that should be able to be to address health at the end of it all. So linking health, air pollution, the effects of air pollution, as well as the specific actors within towards a shared vision, that's very important, and I think that can be able to address our pollution. Thank you.
Thank you very much, Dr. Dan, and thank you. We are online. We have online participants. I request our call moderator to bring the question from online.
So the question is, how might intersectoral fragmentation between health, environment, and finance make the other gaps worse? Any of you can respond to this question. The participants online are actually listening in.
I assume I have the mic, so I'll respond fast. Yeah. This is really a challenge because one, you do not prioritize, you do not have country objective country priorities made if there's fragmentation. Number one. Number two, in cases where there's funding for specific activities with the under air pollution, you find that those specific sectors which are funded would be able to go it alone and not necessarily include the other sectors to be able to have a collaborative effort towards reducing air pollution. Thirdly, for example, if we have poor enforcement mechanisms, then it means that all those people who are actually polluting the environment as well as contributing a lot to air pollution will not be taken, will not be held accountable, and that will be able to worsen the situation. Thank you.
Thank you.
Maybe just a small point to say that I think when there is very high level political commitment in a country, that can probably help with the fragmentation, because there is, coming from the top, that the various parts need to work together.
Thank you, Christina. So thank you to our panelists for joining this session. We really appreciate you answering the questions our participants have. So now, because we run out of time, we would like to go for the coffee break before they actually take it away. So please be back in this room at 12:05 so that we may begin with the next session. Thank you again, and during the break as well. Thank you.
Yes, this can be the so yeah. The online team, we shall be with you in the next few minutes, so still join us online. In a few minutes, we shall be back. Thank you.
Welcome back, everyone. I would like to please ask you to take your seats. We will begin with the afternoon session. Yes. Okay, thank you all. I hope you've had a delightful break and that the snacks were very delicious. I myself have had 4 pieces already. And if they don't take it away, I might go back. So for this afternoon session, we will start with environmental health challenges, priority intervention, and best practices. But this session will focus on country perspective. In the previous session, we heard about international organizations' perspective. Now we will hear from country perspectives. And this session will be moderated by Dr. Paul Sauke, who's our Africa Regional Director here. Thank you. Welcome, Dr. Paul. And now we will begin this session.
Good morning, everybody. I hope you are all back from the coffee break. My name, as you've heard, is Dr. Paul Sauke. I'm the Africa Regional Director for Global Environment, Global Health and Pollution Alliance. Now, this is not going to be a very long session, and then I will not take a lot of time articulating what has already been said. We've had the scientific bit a bit. We've heard about the international organizations and what they do, a bit on funding mechanisms in the morning. And but this time now, we want to go down to the nitty-gritties of what the countries are doing, countries in the region, how they are addressing environmental health challenges and priority interventions, and of course, best practices. And if you're generous enough, you can also talk about best available technologies, things BATs, BAPs and BETs are things we've talked about for very many years, and I think they should be routine language in your presentation now. Without taking too much time, I'd like to call upon Dr. Leonard Tampushi, Principal Environmental Officer with the National Environmental Management Authority, Kenya. Dr. Tampushi, welcome.
Thank you very much.
Just give us a brief second as we are pulling up the presentation, please. I feel like Kenya is treating us very well so far.
As they put up the slide, I want to say I'm happy to meet some friends here today. We feels, most importantly, my mentor, Francis Kihumba, Kiumba, can you please stand up a little bit? I want you to be seen. Kiumba is our elder. He's worked with the Ministry of Environment and Chemicals and Mayor's department for many. In the ministry when I was still a young man. I was even shorter than today. And he made me taller. He made me tall himself. Kiumba, we are happy to see you here, and I'm sure he did a lot at the global level, the various conventions to align the national regulatory frameworks on chemicals and pollution management, waste management, and many other things. So, karibu sana, feel at home, Bwana Kiumba. And also my friend from the World Bank, Jen. So, can you say hi? So welcome. We worked with the also implementing a regional project together, funded by the World Bank. And I'm so happy to see her here in Kenya again. Karibuni sana. Semeni karibuni nyote. Amujambo. Okay. Good. Thank you very much. I also want to make my presentation so briefly. I'll focus much on the national issues. And I hope I will be brief enough because I know I consume quite some minutes later in the morning. But today I want to try to, oh, sorry, it's okay. Good. So in Kenya, this is just a very brief perspective. I've not actually indicated all our challenges, but I took the most prioritized ones and the one that the country is taking it as a priority for solutions, what we've tried to make interventions. And one of them is actually, if you see, the issue of hazardous chemicals and industrial pollution. A plastic pollution, now a global issue, regional issue, is also the same thing we are facing in the country. And also the issue of poor waste management, emanating from different challenges that we're facing, including infrastructural issues, technical capacity issues, and many others. Uncontrolled e-waste disposal is one of the biggest issues that we have. And I'm sure each one of us is aware that they are contributing a lot to the issue of the POPs pollution globally and also in our country. But what we are trying to do is, first of all, we are putting up our regulatory issues, trying to put up tools and frameworks to make sure that we be able to manage our e-waste in a manner that is sustainable to the environment and also to the human health. Air pollution, of course, we've made so many strides, though I know it's still a challenge. You heard about the statistics that I gave that are affecting our country, but it's one of the key issues, even that our head of state is so keen to make sure that we deal with the issue of air pollution, both industrial and also the issue of mobile pollution sources. What we've done in the last few years, last two years, you can say the last 2 years, the National Environment Management Authority managed to come up with a number of regulatory frameworks. That's why you see some of them are 2025, 2022, 2024. They are the latest tools and instruments that we have developed in partnership with some of our partners. And allow just me in this forum to really, really thank the World Bank through the project that we were implementing together, that they supported the establishment, rather development of some of these regulatory frameworks. We really appreciate for that. Management of toxic and hazardous chemicals and management material regulations of 2024. This one is strengthening the regulatory framework for environmental governance. If you come to NEMA now, or even if I just open my laptop now and take you to a system that NEMA has developed, an environmental systems, to register any chemical that's come into our country. We started just a few months ago. So if you're coming in with any kind of chemical, you first of all register that chemical so that we have a full database of the kind of chemicals that we are receiving in the country by explaining the purpose intentions for use, how are you going to dispose at the end of the day, and actually where are you going to store them? Mode of transportation from the port to your storage facility. So we have developed a comprehensive system to manage chemicals, right from the port of entry and also the use, the entire life cycle. Extended producer responsibility regulations is one of the key regulations that we've developed recently also. We are registering all products, everything. They have to comply to the PROs that any product, any producer must be a member of a PRO before they can be allowed to do the packaging, plastic packaging and all that. Draft electrical and electronic waste management regulations. This is still a draft form. We are working on it to make sure that we gazette in the near future as soon as possible. Sustainable Waste Management Act of 2022, dealing the issue of the value chains of waste, right from also production to disposal. Air quality regulations. This is another part of our interest. NEMA has developed a system which is going to be operationalized in the next few weeks. We have what we call COSEMS, Kenya Online Continuous Emission Monitoring System, where all the industries, as we speak now, all the industries in the country are installing some gadgets and sensors which will transfer real-time data to our system at NEMA. So if you go to our offices, we have established a facility whereby you can actually see which industry is emitting which kind of pollutant, be it whatever it is in terms of emissions, how the level of pollutants in effluent discharges, which industries also discharging which kind of chemical, whether they are complying or rather discharging the allowable levels. That is what we are establishing currently at NEMA. And the system is so intelligent enough to tell, even if you try to move that gadget from one position to another to avoid, or rather try to avoid the regulatory measures, the system will detect and it will alert NEMA that that sensor has been interfered with. So that is where we are. We are coming up with such kind of technologies to make sure that we try to manage our environment well. Well, that notwithstanding, of course, our country, we are part of the global coordination mechanism through different international tools, including MERS and other conventions that Kenya is party to, on chemicals, on waste and air, etc. And also this one is enabling us on the issue of cross-border monitoring and harmonized legal enforcement and shared scientific collaboration to reduce risk from hazardous substances. Basically, I mentioned these three because these are very critical conventions to us. I know there are others which I have not mentioned, such as Minamata Convention, but this one, which we have really domesticated fully through different government sectors, through different ministries, and also through the private sector. These three conventions we've been working for so long, for many years, and we are domesticated by developing our own national laws, national policies and guidelines in order to implement these global frameworks. Of course, the issue of GF, global framework on chemicals that the GFC was mentioned earlier, purposely to adopt support countries in reaching a planet free of harm from chemicals and waste. And this is also, that is a multi-stakeholder platform that emphasizes cooperation across the environment, health, agriculture, and labor sectors. Look at the International Organization Program for Sound Management of Chemicals also to cooperate the mechanism between the governmental agencies, including FAO, UNEP, WHO, and OECD to coordinate chemicals management globally. Regionally, I think Kenya is also taking a very active role at the regional level. Look at the issue of the regional centers. These are very critical. These are very critical coordination mechanism that needs to be strengthened, even as we sit here today, because they are formally established through the global conventions. The interministerial networks, that's the ministerial and intergovernmental networks also, regions actively align their pollution goals through bodies, such as Intergovernmental Network on Chemicals and Wastes for either Latin American, the issue of AMSEN, and also the issue of enforcement network supported by UNEP. The Science and Policy Interface is also another very critical platform for us. And if you can see that Kenya is actively shapes and participate in the global science policy interface for chemicals, waste, and pollution. Through the involvement of driven establishment of Intergovernmental Science Policy Panel on Chemical Waste, which builds upon foundational environment policies like the National Sustainable Waste Management Policy, which the ministry actually also developed. The Kenya's role is actively participated in the negotiations and foundational agreements of the panel, and also the delegation led by the Ministry of Environment and Climate Change continues to back the panel to ensure development of nation-received scientific support. Given 2 minutes, but I was into the critical part of my presentation. That's a request for 2 more minutes. This is a case study because this is where we want to learn from, things that have tried to work for us before. The case study on SAICAM PIC project, which was implemented regionally, look at the number of countries which were involved. And the main purpose of this project was to establish the poison centers. I saw somewhere in the program that one of my colleagues from the Kenyatta National Hospital will talk about the poison centers. And this project actually facilitated, well-coordinated establishment of those centers that were regionally in Africa. I don't know if there's any other country which has a poison center, but as per my understanding, there are only 3, and the 2 of them are based in Kenya. So what was the core goals? That was the issue of early warning systems, assessing pollution issues, and identifying research gaps to provide policy relevant advice. And what outcomes you can see, assessing the rate of concluded at 16 Eastern African countries with the designated SAICAM national focal points, which were there, and also network hubs. The project concluded that a poison center network hub concept was the most promising and cost-effective approach for the region, allowing multiple countries to coordinate resources and share, which is forming part of the key objective of this forum. Data scarcity identifies severe lack of baseline data on acute poisonings in Africa, as only a small fraction of countries on the continent had functional poison information centers at the time of the study. So this is how the model looked like, which we can borrow. This was published by WHO. So you see, it's a well-interconnected network of coordination. Purposely to do what? To have the central hub with its specific roles, national PICs, virtual interconnectivity, harmonized data management, standardized best practices, and also workforce development and coordination, resource bargaining and power. Lastly, at the national level, the government of Kenya rather has really managed to come up with a national multi-sectoral committee on sound chemicals management, and this can be a case study for adoption of other scalable approach that can be used in other countries. We have a very active multi-sectoral committee whereby it's bringing all players into the committee, and also ensuring that effective coordination means that all those involved are familiar with each other's main chemical activities, priorities, and positions, and also underlying for reasons for each. Okay. So what are about this committee is about? So simply, it makes up the government and civil society and private sector together. So, and they sit quarterly. The last meeting was just like a few weeks ago, trying to see how they're going to manage pollution, chemicals, and waste management in our country. National coordination, supporting national coordination committees that serves as the best national coordination mechanisms, policy, and international environmental agreements to form up collaborations and partnerships, and also to create awareness and advocacy, data collection, and compliance. These are just part of the terms of references for the committee, and also policy strategy. Ensure that hazardous chemicals managed under global treaties like the Stockholm, Rotterdam, Minamata conventions are properly monitored. What are our achievements so far up to now? The committee has already developed a national action plan 2025-2030, developed the annual work plan for implementation 2026-2027, reviewed draft national chemical policy for gazettement by the ministry, and also aligned the draft chemical policy with the GCF, developed a draft national chemical strategy for implementation of the policy, and also the draft responsible care strategy, whereby it's bringing in also the government and the private sector together to address that issue of the responsible care, domesticate GCF and develop guidelines to minimize chemical exposure and vulnerable groups. Good, thank you very much. On time.
Thank you, Dr. Tampushi. Can I send you to the quarantine briefly? That is a professional quarantine. You will not be subjected to PCR test. Thank you, Dr. Tampushi, for that very enlightening presentation. And I think you've brought policy and action together and also introduced a new element, which is very important, the digitalization of systems here. And I think that's something that many countries can borrow from. Let me not take a lot of time. I'd like to invite Dr. Innocent Achae from Uganda, who is Manager, Division of Chemical Safety, Radiation, Pollution Protection, NEMA Uganda. Thank you, Dr. Achae. Welcome.
Thank you very much, moderator. Good afternoon, ladies and gentlemen. As I've been introduced, my name is Innocent and I work at the Environment Authority in Uganda, the National Environment Management Authority, which is domesticated under the Ministry of Water and Environment. And today, we explore the environmental health challenges, priority interventions, and the best practices, specifically looking at Uganda's perspective. Maybe I stand on this other side. So in terms of our country, Uganda, you can see there, our population is just over 45 million, based on the recent census. And the annual growth rate is just about 3%, and it's among the highest in the world. And you know, a high population growth rate means that significant impact will be felt on the natural resources and the waste infrastructure. In terms of urbanization, we have a very high growing urbanization rate at 5% annually. And so the number of vehicles are increasing as well as the industrial activity. Uganda is predominantly an agrarian economy, and we rely heavily on agriculture. And over 70% of the livelihoods depend on rain-fed agriculture. And we rely heavily on charcoal and wood, which is a main source of energy. Over 93% of the households depend on this. And jumping straight to the pollution challenges, the first and main one is the air pollution crisis, which is really disturbing the country. We have a lot of vehicles, so we have vehicular emissions and affecting the urban, particularly the urban sector. A lot of pollution from air, from the vehicles, and then we have the burning of biomass and waste across the country, which is really affecting the country. And the pollution levels are very much higher than anticipated, above the very much 8% over 8% above the recommended WHO guideline of 5 microgram per cubic meter. So you can see on average it's about about 43, very, very high. And particularly if we focus on Kampala, the PM levels are about 40 microgram per cubic meter. And sometimes in some of the reported recordings of these values, you might find values above 100 microgram per cubic meter, which is really, really high. And then we have the water and sanitation challenge. And as you can see, we have limited access to safely managed drinking water. And the statistics here, 81% of Ugandan households have access to improved water source, but only about 8% have access to safely managed drinking water. That means we have an abundance of water, but the access to the safely managed drinking water is the challenge. And then we have the aspect of poor sanitation coverage, which is a major public health concern. And the statistics here show that 44% of households used improved sanitation facilities, while nearly 50% rely on unimproved sanitation. And of course, the most affected areas are usually the rural ones, where only about 32% of the households have improved sanitation facilities. And we also have the low coverage of the managed sanitation services. And the statistics here show that 20% of the population use safely managed sanitation services. These services are usually outsourced from mainly the private sector, but we also have institutions of government that offer these services. And so this is also present, the open defecation, especially in the rural areas. So you have 6.7% of the households still practicing this, which is quite sad. Even in the urban setting, the open defecation, you find people hissing themselves in the caveras and throwing in the drainage facilities. So it's really a very big challenge. And then we have massive land degradation, especially in the hilly areas where you have severe soil erosion, and so leading to declining soil facility. And then the aspect of forest loss, you find that we have a lot of this. In the 1990s, we had about 24% of our. It is just about 13% today. So we are heavily reliant on the trees for charcoal and so on. And so it is really impacting our environment. So the wetlands degradation and encroachment is a very big thing, especially given that the urban settlements, the urban population is increasing day and night. And so you have the aspect of degradation where people are building in the wetlands. You will find skyscrapers from nowhere just springing up. And recently our executive director was very much annoyed, and he had to go to the field by himself, signing orders of restoration. So a very big challenge on wetland degradation and encroachment. In terms of our energy use, as you can see, the firewood there, and then the charcoal contributing over 90%. And so the rest of these other ones, the electricity, LPG, and so on, just under 8%, as you can see. And we have a lot of this, the bricks that are being laid, in the entire country, relying heavily on the biomass. And that one is a very good example of what we can do to alleviate pollution. We have the Kira EV that I will talk about later on, the electric buses that are being manufactured from Uganda. And then we have the chemical and waste pollution. Chemical and waste pollution take different forms. We have the municipal solid waste, which is a very big challenge for our districts, the local governments, and the cities. And we are requiring them as a NEMA to put their facilities in place to handle these municipal solid waste. We'll have the landfill management. So in the event that you don't have the facilities to handle the waste, you find that the wastes are all over the place. But and we don't have these landfills as a country. We mostly have the dump sites. So you can imagine the levels of pollution in the country. The aspect of electronic waste is becoming a very big challenge. And you see 41,000 tons of e-waste produced annually, and just about only 200 tons is formally collected and recycled. There is the aspect of the plastic menace, which is a very big challenge, especially the single-use plastic. As a country, we've tried to combat this, but the challenge still overwhelms us. But initiatives are certainly in place to ensure that the polluter pays principle, the extended producer responsibility, which regulations are being developed, are some of the initiatives. Then the hazardous waste, the chemical waste, is also a very big challenge, but we do have a regulation now as a country to help and situate that this aspect of the waste is handled. And then the agricultural chemicals, which are managed under the Ministry of Agriculture. We see a lot of these chemicals used in agriculture. Now our farmers prefer to use the chemicals, but the way they are using them is a very big challenge. And you know that when they use concentrations that are not recommended, then they are washed down to the soil surface, and they really later on find their way to the streams, because we are very heavily dependent on the water from the streams and the lakes. So in terms of the interventions and the best practices for air pollution specifically, the country is trying its level best to enforce the air quality standards, and we do have a regulation that speaks to this. And a best practice that we need to highlight here is the air quality monitoring framework, which was developed by AirCo. It is housed in Makerere University, and these air quality meters are installed across Kampala and the other cities. I am also very happy to say that recently we got a donation from the Global Alliance on Health and Pollution, about 30 air quality meters, which we have received. We are very grateful as a country. I think we need to clap for the GAHP. Thank you very much, Maria and your team, for the good work you are doing. And these provide, the air quality meters provide real-time air quality data, measuring PM 2.5, the concentration levels, and so on. And then the clean cooking transition programs. There are a number of programs which have been initiated to ensure that we move away from the use of charcoal and firewood and adopt cleaner energy sources. In terms of water and sanitation, we are trying to expand the water infrastructure, improve sanitation systems, and also to have the community-led total sanitation scaling and fecal sludge management. A best practice is that KCCA, which is the mother city, is implementing the citywide integrated sanitation program. And one of the aims is to ensure that the sanitation services reach the low-income communities, the informal settlements, as well as the marginalized groups. I have been involved in some of their programs, and at specifically how they can give access to the low-income earners access to sewerage services. Because when you go to these informal settlements, you will even finding your way through the homes is difficult. So they are trying to the technologies that can be used to gain access to such areas. And okay, and we have the GALPAs, the GALPA technology, as well as the pupu pump that they are using in these informal settlements. And then in terms of land degradation, NEMA has got a project which is running that helps, that is aiming at restoring 55,000 hectares of the degraded forest, wetlands, and farmlands across 9 districts in eastern Uganda. And this project, they're planting trees and teaching the communities the best practices in sustainable land management. And in terms of energy use, I have already talked about this. The government of Uganda recently came up and they have funded the distribution of some of the LPG starter kits to low-income urban households. Now, if you go to my country, you will find that the government is in partnership with Starbucks to give these gas cylinders to households. I'm proud to announce that I also acquired one. Now I use clean energy at home. And also for chemicals and waste, we are building the EPR framework, which is under consultation from the different stakeholders. But we also have a government entity, Uganda Cleaner Production Center, that is helping the industries to ensure that their processes are not polluted. So prevention of pollution at the source. And there are a number of things that I would highlight. I would say that Uganda is implementing the different multilateral environmental agreements. I'm the focal point for the global framework on chemicals, and we have so many other focal points domesticated within NEMA and the Ministry of Water and Environment. And also in terms of the landfills, we require every local government to set up landfills, and they're supposed to carry out environment and social impact assessments and apply for licenses for waste management. So we are in touch with the local governments. And then finally, let me highlight this as a conclusion. Uganda is looking at the One Health approach to address overlapping environmental and human health hazards. And so we have brought together 4 different ministries that are handling different government sectors to try and help in transforming the economy. So we use this unified approach targeting the priority sectors, the zoonotic diseases, antimicrobial resistance, chemical and point source pollution, as well as the climate-driven vulnerability. And all these ministries and the government authorities are involved in this particular approach. So we are looking at how can we bring the different government arms together so that we can combat pollution and its effects. And in terms of conclusion, you can read that. I thank you very much.
Thank you so much, Innocent. Unless Anna wants to say something. Thank you. Right now, I think we are running short of time. But from Innocent's presentation, I'm beginning to wonder whether here in Kenya we should start walking around with oxygen masks. But let me take this opportunity to welcome Dr. Beata Kimpaye from Rwanda NEMA. Thank you. Welcome. Here in Kenya, we also have electric buses now, and their population is increasing.
I would like to ask the next presenters to please keep it brief and short, as we have to be at lunch in about 35 minutes. So please take 10 to 12 minutes to present, and then we will have time for at least one question from the audience. Thank you.
Okay, thank you very much all. But I want to apologize first. I'm not Dr. Beata Kimai. I don't have such kind of excellent title. I'm only Beata Akimai. So, coming back to my introduction, I'm working at Rwanda Environment Management Authority. I'm leading a division of environmental compliance and enforcement. In Rwanda, we have a lot of environmental challenges, including waste management issue, chemical and hazardous waste issues. But also I have chosen to talk only about air pollution issue, especially the policy interventions and some ongoing practices. Others I will maybe skip because they are common. Allow me talk first. So I want to go back on that slide with pictures. This clearly show mainly the air pollution source in our country. These are coming from the air pollution inventory that was conducted in 2018 that highlighted that the most pollution source is the transport, followed by all those industrial emission, poor waste management practices, and cooking methods that affecting indoor air pollution, and also the ambient air pollution. So lots of are common, but I will mostly highlight that our country has chosen development among others, but combined with environment management. So we want a country that develops economically, but ensuring the sustainability. That picture highlights that our country is focusing mainly on tourism. If we don't do anything on air pollution, we shall lose the best resources that attract the tourism, especially Volcano National Park, that is attracting more, but also we are hosting a lot of international events, conference and meetings. If we can't do nothing on pollution control, you will limit your traveling capacity in our country. So coming to the country initiative and the policies, we have a number of laws and policies to mitigate air pollution. We have the law on environment that was published in 2018. We have also the ministerial order relating to air pollutant emission. We have the policy on environment and climate change, or those legal instruments, especially laws and ministerial orders, have different articles highlighting prohibited acts that are assumed to pollute the air, and they are assigned with penalties. But also coming back to that ministerial order that is new, that was to amend the previous ministerial order to include the recent initiative, because these days we have introduced the new approach to monitor vehicle emission, because previously our ministerial order highlighted that we only conduct vehicle technical control, but right now we are also reading the control of vehicle emission, including the air pollutant on motorcycles. These are also domesticated regional standard related to air pollution control. Okay, thank you. As part of air pollution monitoring also, we have across the country 21 air quality monitoring equipment, but observing that they are limited in number and they can't provide real data, we have a project together with the Italian government. We are procuring other additional equipment that can double this number to monitor how the air look like in our country, and maybe to provide basis for policy interventions. These are to highlight how the real-time data on air quality across the country look like sometimes. These are the government initiative, REMA and the Rwanda National Police for vehicle emission testing. We have also different initiatives like Car Free Day. We have massive sport during the weekends. We have also initiated in the last 4 or 5 years the electrification of motor vehicles to change them from fueled motorcycles to e-motorcycles. But coming back a little more on this, because of the issue of hormones, now we are pushed to move on e-vehicles, especially motorcycles. We are putting a lot of effort. We have also, the government also has promoted efficiently the public transport. Like 1 month ago, our government, especially in Kigali, we have developed a system where public buses, they have their own lane. No private vehicle can pass through that lane. But also the government, in partnership with the other private companies, they are purchasing more public vehicles that are using electricity than fuel. I think I can stop by there, but the PowerPoint presentation highlight more. You can go through and read. We have lots of government initiative to address air pollution, but also maybe for another discussion, we should discuss chemical and hazardous waste management initiative, wetland protection to remove pollution, because right now we have rehabilitated 6 wetlands to remove chemicals where industries were seated previously. They have been relocated in the industrial parks. Thank you.
Thank you, Beata. Thank you very, very, very much. Realize that Rwanda is very heavy on policy. Let me not waste a lot of time, but welcome Dr. Lemlem Tajebe Legisa from Ethiopia, NEMA. Dr. Lemlem, nice name.
Thanks so much. And I would like to appreciate GAHP to organize such an important gathering or meeting, because various stakeholders are gathered here to raise and discuss on an important issue, which is the environmental health. So my name is Lemlem Tajebe, and I'm from Ethiopian Environmental Protection Authority. I am the lead executive officer of environmental management. So the current priority environmental health challenges in Ethiopia are, the first one is there is the problem of inadequate water, there is a problem of sanitation, and also there is a problem of the hygiene service, which is, we call it as the WASH. And the second one is there is a poor solid and liquid waste management. And the other one is there is a serious problem in the case of the air pollution, sound pollution, water pollution, and the air pollution. These are the serious challenges which Ethiopia is facing, and the other one is the chemical and hazardous substance. In the management of this chemical and hazardous wastes, this become the serious challenge. The other one is the rapid population growth and rapid urbanization become the core problem for Ethiopia. And the other one is the use of single-use plastic and also the pollution are the problems. When I'm coming to the challenges, so as I stated earlier, the first challenge is that is inadequate water, sanitation, and hygiene is the first challenge that facing Ethiopia. So when I'm coming to the, this one is, I was sending the, this is not the presentation. I was sending the updated version of.
This is what she sent, right? So you sent a presentation, but the newest one you sent, we couldn't download, so it wasn't uploaded. So this is the first version you shared.
Okay. So the first one is inadequate water, sanitation, and the hygiene, because the first one in So in this inadequate water, sanitation, the hygiene, one of the problems are there is the problem of open defecation in various parts of the country. There is the problem of water access. There is the problem of the irrigation water. So in order to eliminate the inadequate water, sanitation, and hygiene problems, the government established the WASH program, which is the water. The One World program was established by the Ethiopian government. So this program is able to develop different, sanitation facilities, especially for the rural people. So the problem of, the sanitation, it comes to reduce due to this program. And the other one, there is a serious problem in the poor solid and liquid waste management. Most of the solid waste are there dumped in the open space. And the problem of landfill, which is the problem in Ethiopia, the standardized landfills, we don't have much standardized landfills. And also there is a problem of liquid waste management. And also we lack the proclamation or regulation in the liquid waste management areas. So due to this poor solid and liquid waste management, most of the people, just dump their wastes in the open space, and this leading to most of the waste there migrated to the environment and also the water bodies. This contaminate the environment and also the biodiversity also. The other one is there is air, soil, water, and sound pollutions they are the serious problem which facing Ethiopia. When I'm coming to the air pollution, we are dividing this into two. The first one is the indoor air pollution, and the other is the outdoor air pollution. Indoor air pollution, as you know, Ethiopia as a developing nation still use, especially in the rural areas, they are using the fuel wood. They are using dung, they are using charcoal, they are using, crop residues for cooking. So this one is creating the gas, the carbon monoxide which is generated due to this one, and most of the people get sick due to this indoor air pollution. And the other one is increasing outdoor air pollution from vehicles, and there is from industries, the construction activities, particularly in the urban areas. So, as you may heard, our Prime Minister is initiating the corridor development, you might heard. So in order to prevent the vehicle emission, non-motorcycles are, appreciated to use in Ethiopia. And the other one is, it is banned to import diesel cars. And the other one is in order to minimize some of the pollution from the industries. Ethiopia already, there was one regulation which is known as environmental impact assessment, and our environmental impact assessment, it is changed to environmental and social impact assessment, including the social element. And most of the pollution which comes from the industry's Environmental Protection Authority is doing a great job to regulate all the industrial pollutions. And the other serious problem is, when you're coming to the indoor air pollution, the government is promoted improved cooking stove, especially the Ministry of Water and Energy is doing great job in collaboration with GIZ. It promoted improved cooking stove. The clean cooking energy programs, it's become highly working, and also the vehicle emission, all the old vehicles are inspected whether they are conducting maintenance or not. They are very, very seriously. And also the expansion of public transport, especially using the electric cars. By the way, it is very appreciated to import e-cars in Ethiopia, and the price might be less as of the diesel cars nowadays. And also there is also industrial pollution control, seriously, as I said, and also there is a development of renewable energy resources. So as you know, Ethiopia is also known as 13 months of sunshine. So we have a solar, the sunlight is in the 13 months. Ethiopia don't have 13 months, and all the time we do have sunlight. So we are using the sunlight and the wind energy and the hydrology. So we are using the renewable energy development is intensified. So the other challenge is that in the case of the chemical, in the hazardous substances now time, due to the population growth, due to modernization, this chemical and also hazardous substance management, it becomes tricky to manage to Ethiopia. So there is, as we know, there is unsafe handling and disposal of industrial chemicals. Most of the chemicals are imported, however, they are not safely handled. They are not safely disposed. This one is the serious challenge to Ethiopia. And there is limited capacity for monitoring of environmental pollutants. Here also, when you are coming to the chemical and hazardous substance management, Ministry of Health, Ministry of Agriculture, Ministry of Industry, and EPA do have roles to register all of the, including the Custom Commission, to have the right to register all of the chemicals which are entered to the country. Okay, so there is, the GAHP in collaborate with this organization. So the other one is there is a rapid urbanization as the people become rapidly growing, and as the people become, rapidly urbanized, especially the people who are living in the rural areas comes to the urban area. So expansion of informal settlements with the inadequate sanitation process or the basic services, this increasing pressure on water supply, and also the amount of waste which is released from these communities is increasing. It's become so challenging to manage. The other one is the problem of single-use plastic pollution. The other one is the use of single-use plastic pollution. That is the serious problem in Ethiopia. And also this single-use days of single-use plastic, it causes environmental pollution. As you know, there is a blockage in urban flooding, and there is a soil degradation, and there is agricultural productivity, there is a public health risk, and also there is a economic cost. So in order to abate the problem from the single-use plastic, Ethiopia legally enforced penalties and also developed regulation starting from January 31 of this year. That is known as, the solid waste management and disposal, the regulation. So these are some of the regulation Ethiopia currently implemented. The first one, this one, which is known as the National Circular Economy Roadmap of Ethiopia. I'll give you a brief later on. And this one was the proclamation on environmental pollution control. And this one is a proclamation on the hazardous waste management and disposal control. Here, all of the hazardous wastes, who importer of the hazardous wastes, all the chemicals, have to have registered first, have to, safely use it, and also when finalized using it, have to safely dispose it. So the other one is there is a proclamation on the waste management, the solid waste management and disposal proclamation. This one is the proclamation that we currently ban the use of single-use plastics. So when we are coming to the key intervention and best practice implemented in Ethiopia to address the challenges of environment, the first important or the best thing is the banning of the use of single-use plastic bag. So due to the banning of this single-use plastic bag, at least we able to reduce the amount of waste, solid waste, which is generated in Ethiopia. So they are rushing, so let me come to the best practice that can be adapted in the region. So as I said, Ethiopia developed the National Circular Economy Roadmap. So the National Circular Economy Roadmap that consists of different sectors, the sectors from 10 organizations. We are working with 10 organizations. As you know, the waste, one organization cannot, work alone in order to abate the problem of waste. So to mitigate the problem, we coordinate these different organizations and develop the National Circular Economy Principles. Thank you.
Thank you.
Thank you very much, Lemlem. Very quickly, one thing that you may need to know from Ethiopia is that they banned the use of fossil fuel using vehicles. And it's one practice that other countries in the region could adopt. Very quickly, let me take this opportunity kukaribisha wenzetu kutoka Tanzania, wenzangu kutoka Tanzania, Dr. Kanute, Sabuni, Uganda, Tanzania NEMA. Dr. Sabuni, karibu sana. Wenzako this is up and this is down. Yeah.
Good afternoon to every one of you. Yes, first of all, I would like to thank Global Alliance on Health and Pollution for welcoming a representative from Tanzania on this regional pollution forum. I'll be taking you through environmental health challenges, priority intervention, and the best practices in the United Republic of Tanzania. As I've been introduced, my name is Epaphroditus Kanute Sabuni. I'm working with the Vice President Office, Division of Environment, Section of Environmental Management of Pollution. My presentation will be with the following outline. I'll be talking about the current priority, environmental health challenges, one key intervention, and the best practices implemented, lessons learned, what worked well, and also highlight of practices that could be adopted in the region. Overview of waste management. Waste management is one of the environmental health challenges in the country. Per capita generation of municipal solid waste ranges between 0.6 to 0.9 kilogram per day. With a population of 59, the estimated waste generation ranges between 14 to 20 million tons annually. This is according to National Bureau of Statistics of 2022. On average, only about 33% of the municipal solid waste generated is collected. There is inadequate waste sorting at the source. Recycling accounts for only 5 to 10% of the total municipal solid waste generated. Subsequently, about 148 meter cubic per day of sewage is generated, while less than 30% are collected and transported by truck and the sewer networks in the country. This is according to EULA 2018. Only 10 out of more than 100 urban centers have sewage system, which serves less than 20% of the total urban population. As you can see the pie chart, that is the major source of municipal solid waste. Composition of municipal solid waste. Organic materials comprises 63%, plastic waste comprises 12%, paper 6%, grass 4%, metal 1%, and the others 12%. Key intervention and best practices implemented. The government, with the support from SIDA, Sweden, accessed the fund to implement a project that aims to enhance the implementation of Environmental Management Act, Caption 191. One of the project activity is to develop the National Solid Waste Management Strategy. The motive is to improve waste management system, reduce persistent organic pollutants and greenhouse gases emission, and improve the livelihoods through circular economy. Lesson learned, what worked well. The government has opted a circular economy model for efficient way of optimizing waste resource through reuse, recovery, and recycling. Promoting waste minimization can create jobs and improve environment. Hence, strong policies, effective enforcement, and empowerment local government authorities are key to turning waste into value. Generally, implementation of this strategy requires key stakeholders' full and effective involvement in this discourse. Another environmental health challenge is the access to improved toilets. Reaching out the last mile population with no access to toilets. Approximately 2% of the population practices open defecation. The goal is to eliminate open defecation and promote available affordable improved sanitation supplies to support them on the construction of improved toilets. Key intervention. What we have done is implementing of behavioral change campaigns. The initial campaign was Mtu ni Afya, and the country later initiated the Nyumba ni Choo, launched in 2017, the national campaign, meaning a house is not complete without improved toilet, leveraged modern behavioral science. Currently, the country is implementing the Mtu ni Afya phase 2, scoring up from the first phase after 50 years of implementation. Supply chain development, expanding the network of local retailers and the artisans to ensure lasting mile families can purchase affordable, durable sanitation products such as sato pans. These sato pans are very affordable and also they are cost effective, can be purchased by the community. Key deliverables, what we have been done. Increased access to improved toilets from 39% in 2016 to 78% in 2026. Increased the percent of households with basic hand washing facilities with the soap and the water from 16% in 2016 to 47% in 2026. Also reduced open defecation practices, household without toilets from 5.7% in 2016 to 1.1% in 2026. That is the map which is showing access to improved toilets by region in the country as of March 2026. You can see the map with the toilets improved latrine coverage. Other environmental challenges in the country are air and water pollution. Indoor air pollution from biomass fuels used for cooking, outdoor air pollution from transport, industry, and open burning of waste. Air pollution contributes to respiratory and respiratory and cardiovascular diseases. Contamination of water sources from improper agriculture runoff and industrial activities. You can find in the country, there is a lot of industries which discharge wastewater into water sources, and this is a very big problem. Inadequate sanitation increases the risk of waterborne diseases. Lesson learned, what worked well. Strong political commitment is essential for successful implementation. Multi-sectoral coordination leads to better outcomes than isolated sectoral actions. Stakeholder participation, including local government authorities, academia, and the private sector, improves ownership and sustainability. Capacity building strengthens implementation and the compliance. Policy and the strategic frameworks provide a common direction for institutional and the partners. Practices that could be adopted in the region. There should be evidence of full duplication of efforts. Sectoral ministries should work together and make sure that everything as far as environmental health challenges are reduced at a very great extent. Sectoral ministries should not work in silos, but should work in collaboration. Also enhances information sharing and improves the compliance with the international conventions, and these international conventions are such as Basel, Stockholm, Rotterdam, and the Minamata Convention, and also support evidence-based decision-making. This marks the end of my presentation. Thank you for listening.
Congratulations, Dr. Kanut. A very important aspect of waste minimization. And that is reuse, return, and recycle, which is one common principle that needs to be used. I think that brings us to the end of the presentations. And now that I've quarantined all the 5 participants, I would want to open this Q&A session with my first question, and any of you can answer at random. And that is based on your experience, what is one scalable mechanism or policy that has effectively reduced pollution exposure or improved environmental health, which could be replicated? Please provide one concrete example. I know you've given several examples, but one that actually stands out very critically. Yes, Beata.
I think my interventions will address also a challenge for improved toilet in Tanzania. I want to share some best practices. In Rwanda, 10 years or more ago, we have experienced such challenge where the population had inadequacy toilets, but also some houses with how do you call the shed, grass shed.
Grass patched.
Yeah. And you know, the population, our population has a culture to support each other. And this is supported by political will. When a mayor or any other leader observe that there is, we call them in a global human security issue, if a person or a household doesn't have a toilet, we have a program called Umuganda. It's a community work approach, usually practiced at the end of every month on Saturday, where the community leadership with the population together, they have to do something related to cleaning, removing waste in the drainage, on public place. But when they identify someone with an improper toilet, they work together to construct that toilet for that neighbor. It's a common practice. It's a shared practice every month. For that, people maybe they have the issue of money to construct those toilets, or for those houses, the population led by their top leaders, if they meet together with moral spirit, we construct those toilets, we construct those houses for our poor population. Thank you.
Thank you so much, Beata. You talked about sanitation, especially a rural problem. And probably one more person who could highlight what they do that could actually be replicated within the region. Yes, Lemlem.
Okay, thank you. So one of the important initiatives that can be adapted to the region is that Ethiopia developed the National Circular Economy Roadmap. So as I stated earlier, the problem of the waste, the pollution, and also the management cannot be handled by one organization. So what we did is that we, decentralized, and first we gather some of the important sectors. For example, the Minister of Agriculture, the Minister of Health, most of the organizations that generate a good GDP and also that employ the highest staff, and also they are assumed to be contaminate or release the huge amount of waste, they become our stakeholders. And we develop the action plan and we provide them to implement it by themselves. And in that case, we develop the technical working group, we develop the advocacy group, and also we develop the resource mobilization group. So the Minister of Urban and Infrastructure become the chair of this technical group, and we able to coordinate the problem of the generated waste and also the problem of the circular economy. With this, we able to enhance the people's understanding on the issue of circular economy, and also by their sector, they start to enhance, to circulate, to redesign, to reuse all of the resources that is generated and also used by specific sector. So that is the National Circular Economy Roadmap is one of the initiative and one of the best experience that can be adapted by the region. Thank you.
Thank you very, very much. Circular economy is a very serious issue that needs to be taken up regionally. Let me call upon Kenya to make a quick response, just 1 minute. And then Dr. Achai, just 1 minute, and then Dr. Kanute.
Well, thank you very much. I think for us, we have a number of items that we can actually borrow, but I'm going to mention very few of them. Like a few years ago, we had a serious issue on plastic pollution, a very serious, that single-use plastics was almost becoming our national flower. So we came up with simple, implementable, coordinatable policy guidelines to eradicate plastic pollution in Kenya. And I think so far, I am so proud that so far, we've really tried to do our best. Our challenge, and that is why we have this forum today, our challenge is actually the regional coordination mechanism to eradicate plastic pollution, especially on single use at our border points. Number two, recently, we are doing a lot to develop what we call the material recovery facilities across our default functions. We've done quite a number so far, and the government is trying to scale it up so that every county government should establish a material recovery facility to support the issue of circular economy and sustainability in terms of waste management. Lastly, the country, we have a serious problem when it comes to highly hazardous asbestos roofing materials. So right now, it's our national interest to safely remove and dispose asbestos from all public and private institutions. The Cabinet Secretary, through a directive from the Cabinet, already published a public notice that every institution with asbestos roofing should ensure that it's a safe removal and disposal, where NEMA has already licensed several landfills where they can take those asbestos for good and proper disposal. And with that, thank you very much.
Thank you so much, Innocent.
Thank you very much. As a country, we have a national entity for safe management of hazardous chemicals. You know that hazardous chemicals waste, at NEMA, we license companies and entities that are in the business of waste management. And specifically, the country identified that the hazardous wastes are a big challenge and involve enormous investment. So the country set up a facility which is a national referral facility for especially managing these wastes. So we have private companies that pick up the hazardous waste, like the used oil, for instance, and then they take to this facility, which then handles them safely using the recommended best practices. This is the National Enterprise Corporation and the Luwero Industries. Thank you very much.
Thank you so much, Innocent. Dr. Kanute, just 1 minute.
Thank you very much indeed. As a country, we have managed to tackle the issue of environmental health challenges by strengthening multi-sectoral coordination and the institution coordination for making sure that waste management is well handled. This multi-sectoral coordination, they are working together so that they can, to make sure that waste is really managed well. These ministries, they are not working in silos. They are working in collaboration so that to make sure that waste is really managed well. And that through that, we have been very, very much successful. Thank you very much indeed.
Thank you so much, Dr. Kanute. Now, very quickly, let me take this opportunity to thank you, all of you from Kenya to Rwanda to Uganda to Ethiopia to Tanzania for those marvelous presentations. I think we have benefited a lot from the presentations, and some of the issues that you shared, I think, will be circulated around. And then during the discussion groups, we can pick up some of the issues that we need to collaborate on. First of all, let me also take this opportunity to give 3 key takeaways that have emerged during this panel discussion. One is that policy alone is not enough. We need enforcement capacity and local adaptation, which is a very, very powerful approach that we just don't talk about these things in the meeting rooms, but we also go out and enforce policies in order to achieve maximum results. Then replication requires cross-sector collaboration, and that means linking pollution control with health, agriculture, and livelihood. Some of the rural issues have actually come up during these panel discussions. For example, the flying toilets are not just unique to Kibera in Kenya. They are also found in Uganda, also found in Rwanda, it's also found in Tanzania. So it has become an urban feature that we need to deal with, and that requires a multi-agency approach to manage. Then, of course, the issue of data. Data is very, very important for policy making, and we need to do research. We need to document everything that we are doing. Policies. Thank you.
Thank you, our panelists, for this wonderful session. And thank you, Dr. Paul, for moderating this. So now is the best time to announce that we'll be taking the lunch break now. So we'll be having lunch right outside of this room on your left-hand side. Please be back in this room in 45 minutes exactly. That is 2:25, so that we may begin with the other sessions. Thank you.
That's just the fact that I'm down, don't let them out, they're all the right. I don't want to. Maybe you're not inside stuff. No. They should just go on, right, they're. I did one on that one. I did one time and one to back to you actually, you want to do some. Oh, I bet before I ended my career, I'm going to send you a message. Don't have gifts. 4 hours. So 4 hours you do, this is a magnetic. Our brain cycle. It's not a bit nice. It's for the bit down. But since you don't need anything that day, they're like you can make sure more people that almost humble. These are typical bread. Bread that we give over there. Oh wow. Thank you. I'll give you a call right now. I don't ever get something. I go for breakfast everyone the world thing. No, this is the field where I used to go or it's the 70 of your laptop. I'm the long traffic. Then traffic type of time and we did plan it. Like you look at too much waste time in my when I was working in there. We changed my room out five and go. And that's around now. Like that. No. Also, that's one. Well, I did one for you. Didn't want to be one for me. Look. Go down the way, you keep that way. That's okay. Oh, I love it. I thought well, we are only now, because we just take forever for practice, and tell them practice. Over. Over the structure. Then I'm not even saying it to people. No, it needs some naturally. Wow. Naturally. Because now we learn the words and everything, both the flights that were in this one. Yeah. So they're fully fast. Oh, fast. Yeah. And it's still the best airline flying. Yeah. I can do. The outline Virgin was up direct from London. It's 6 hours. We're gonna have to 6 hours direct. Like 17 hours for us. Oh, you have to go to Istanbul and then it's one. So you're not coming to the at all. Rồi mà. Thế là con đứa con này. Đấy, nó quan. Right, right. Người ta thấy là cái nó. Nó.
준비해 보고. 하나 다가 준비해. 또.
Có đặt cái gì? Nó rồi cho tôi. Có cái Đồng thời nhân là như vậy thì
Đây là 준비해 ta phân.
người ta có cái gì? How did it? Mỗi lần
Tập tập ra. Không cần nữa.
lòng ra đâu? Lòng ra đâu? Ra vào sau.
Đi còn rồi.
Ôi. Thì có thể sao lại mình Nó cái tôi đó. Apa ya? Tôi lấy ra của đây. Thế giờ là tôi mình tiền nada. A ver, ¿y qué con la idea, no? Yo les dejo con usted. Aquí no está trayendo, no está trayendo. Pues, por el de la y checa, hay que estar acá. Entonces, que antes, que la gente, que la gente, la gente. Bueno.
Đặc biệt là hôm nay tôi nói được nhưng mà tôi đây nó nói như việc làm rồi thì sao thì làm được nó phải cái mình được yeah tôi được cái tôi có tập trung mình sẽ không làm còn cái tập trung luôn đấy cái tập trung luôn đấy yeah yes mà nó yeah well yes put it down there no I think you're very important to be it's very important to use the Rồi chỗ này thì có nó tập hợp cả thì chọn rồi đây chính là cái mà tiền nhà nó đi học đó nhưng có nhiều người thì đi sau thì nó tí được tôi chỉ có nói là đi thôi với cái không có thể quay đâu đâu tôi cảm thấy sẽ cao lên như là kia cũng là không biết đâu chỉ có tiền cho cho tiền cho cái cho rồi phải ăn giờ không có sự gì nó bắt đầu mình chưa có cái đó but that would choose my body so that you can now do up already.
Hi. Action. Action. Mama. Second government, that we elevate. One, yes, address the head. You address us what? Yes, 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 that's it. That's it. Good job. All right. Look down to the window, no? I purple one. That's not the purple. You are indicating for the stamp for yours. Here you are, thank you. I am to them, yes, you need to be bigger. I think what I think that's there, means it's very. I'm going to make such a thank you.
Just look at the presentation to make sure it's the right way. Okay, that's up here. Right.
Further. It's not PDF, I have. Okay. Next. This is how else. Going. Yeah, okay. All right, cool. Next. Okay. Oh, this PowerPoint is not used. Ah, okay. I think that animation. Oh, all slides, eh? All right. Right, thank you. Yeah.
The world don't want that. Huh? Look at this. I don't think you are aware. That's really old.
Coming in at the level of that message. So, just not a fun day like that. Man, you think about what? I live on here. But just you got it. You get through it every day.
I wanted so much to say. Now I'm going to jump off the boat. You see what my community? You know, it's a flash. Just a moment, you're my computer. They are in this probably now. They want to like, well, that's how the talk was on you. The body.
Hello, everyone. Good afternoon. Brayo, can you please raise your hand for the others in the launch area? So we would like to now proceed. We wanted to do group picture before we went to lunch, but because we had to keep our time there, so let's please join us on stage here in front of the banner so that we can take the group picture, because some of you will be leaving before the end of the day. Please join us up front. Yes, that's what Brayo, Paul, Dr. Paul, can you speak to the photographer so that he can come? We are taking the group picture. So you make the first photo.
Yeah.
Reserve me a spot.
And you go find her.
Yes, that's what I was telling her. Reserve me a spot. Okay. Yes. And then we'll have to before you group picture time. Yes, let's go up front for the group picture. Let's go up front for the group picture, please. Excuse, we are taking group picture, please, and we would like to ask you to come in so that you could be in the group picture because we are starting the afternoon session now. I would like to repeat once more. For the forum, we are restarting now with the group picture. Please join us so you could be a part of the picture. Raymond, group picture, you have to go there. Yes. Group picture. Yeah, I call everyone. So if they are missing, we'll have to do the picture because group picture, please join us in the room. Excuse me. Sorry for interrupting. Can you please join us for the group picture? Group picture. Where's the photographer? Faith? He's here? Yeah, okay. Because when I left, he wasn't. So I wanted to make sure he is. Okay. Sir, excuse me. Where would you like the line to be cut so that you can see everyone?
We miss people. What should be the performance?
Okay, thanks for, there's more space here,
We
right?
need people. Everyone was watching, right?
On this and what, when, excuse me again? Well, no, I don't think I'm like. Yeah. Oh, God, yeah, somebody. No. So one more person can sit down. Excuse me, lady, maybe she can have a foot in because the hand line.
But now we do one, but then we have to take another one. There are my board members meeting, like.
Okay, yeah, tell me.
Run! One we have. What is done? Just is not that because of thought. So we will make a quick money.
Wait. My mom. We are ready. Nice. Thank you.
We have to join the corridor, wait. Run! Yes.
It's going towards pollution analytics.
After lunch, I mean. There are times. Yeah. Wait.
Yeah, that's our pollution. Okay, that's okay.
This is the black pepper. You see?
Yeah.
Yeah, and I just raised some question. Yeah. Can you call Brian on the? That thing. Ah, shit. That's about it. I'm not going to set it. I'm not going to do it. I'm not going to do it. No, that's about it. Break that. You need to have every time you get this on my feelings. Yes. That's all. I'm going to count it on the time now. So I'll call you from the room. I have to keep. So I'm making this. It's going to ci siamo aventi presentation in Taiwan. Grazie per domani ritual. Yeah, because that's all about it. Yeah, we want to just Suzanne.
Hello, everybody. Are we all back from lunch? All feeling nice and full? I hope you enjoyed that tasty lunch and you're ready for the afternoon's activities. My name is Alice Evans. I'm the project manager at Defra, and I'm happy to serve as the master of ceremony for the session while Anna moderates our next session. So this afternoon's panel will continue our regional exchange with the panelists sharing experiences, success stories, and approaches to pollution management and health protection. So following the presentations, we will then open the floor and hopefully we'll have a little bit more time for questions and discussion. So without further ado, I'll pass over to Anna.
Thank you, Alice. Good afternoon, everyone. So this session continues our regional exchange with panelists sharing experiences, success stories now, and from the different programs, for example, the EPP that was funded by the UK government. So now I would like to invite Dr. Emmanuel Tebadeke, National Coordinator, to present on the Health and Pollution Action Plan. She actually coordinated several GAHP projects in Uganda and also led the EPP, which just ended in March, which was a wide program covering different things: air pollution study, health and pollution action. And welcome, Dr. Emmanuel.
Thank you very much, Anna. I'm Dr. Emmanuel Tebandeke. I'm the National Coordinator for the Global Alliance on Health and Pollution Activities in Uganda. I'm also the head, Department of Chemistry, Makerere University. I am happy to be here. I would like to thank the previous speakers, those who gave opening remarks, those who gave the keynote address, and the duty bearers from the different countries because you gave a foundation to what I want to talk to. You talked about the different pollution challenges. You talked about the different interventions. But what this is all about is, of the different pollution challenges, how do we set priorities to see which one to start to deal with? And of the different interventions, which one should we select to apply for a selected pollution challenge? So the Health and Pollution Action Plan, this was implemented in Uganda by the Global Alliance on Health and Pollution in partnership with the government of Uganda through NEMA and other stakeholders like Ministry of Health and KCCA, and was supported by Defra of the UK government. So this HPAP was part of the Environment Pollution Program, which had a number of components. Of course, there was the development of the Health and Pollution Action Plan, but there were other components within the program, which included a source apportionment study on air pollution, a civil society-led campaign on pollution management, an economic study on impacts of pollution, and other activities. So what are the goals of this Health Pollution and Action Plan? This is a program which is mainly developed to help governments to identify the pressing pollution challenges, to set priorities of which challenges should be addressed first, but also to come up with sustainable and efficient interventions that can help to address the identified pollution challenges. Then, of course, it evolves out of collaboration with government ministries. It involves advancing specific recommendations to address the pollution challenges and development of concrete concept proposals that can be used to address the pollution challenges, reduce pollution exposure, and also reduce the related illnesses. So the process basically has about, it has 4 steps. The first one is analyzing the national pollution issues or challenges. The next one is setting priorities on which issues should be addressed first. The next one is designing programs that can help address the identified pollution challenges. And the last one is working with the government entities to engage donors or funding agencies to help in the implementation of the action plan that has been developed. So in Uganda, as I said, this process was first implemented by GAHP in collaboration with different agencies, ministries, and departments, and supported by Defra. Initially, we started with the stakeholder engagement, where key ministries, including Ministry of Health, Ministry of Water and Environment, and others, NGOs and public and private sector organizations were engaged and consulted on the different pollution challenges in the country. A preliminary assessment report was produced to highlight the different pollution issues in the country, and the report identified air pollution, including indoor and ambient. It identified water pollution, waste management, contaminated sites, agrochemical use and misuse, and heavy metal pollution as major pollution challenges in the country. Next, we had an inception meeting where different stakeholders were consulted to review and discuss the preliminary assessment report and to identify any gaps in the report, if any. And after that, we created a technical working group to review issues of the action plan drafting, but also setting priorities on which areas should the plan focus. So we had a number of meetings involving the technical working group. We had 5 meetings where we drafted the action plan, but also developed concept proposals to address the identified pollution challenges. The draft action plan was internally validated by the technical working group, where different members, stakeholders were invited to review what has been drafted by the technical working group. And from there, of course, the pollution action plan is submitted to, this was submitted to NEMA, such that it can be forwarded for government endorsement. And then of course, going forward, it would mean that government ministries or departments would now start to find ways of how this can be implemented. So briefly, that was the process. So if I give you a highlight of what was identified, in the assessment report, we had a number of pollution challenges. That is ambient air pollution, indoor air pollution, water pollution, improper waste management, agrochemical pollution, and heavy metal pollution and contaminated sites. And these were the key pollution challenges that were identified in the country. We looked at the policy, regulatory, and institutional framework for management of pollution, and this was seen to be in place. However, there were issues of enforcement and also coordination. From the identified pollution challenges, the technical working group now started to set priorities on which pollution challenges should be handled first. If you look at that, so the identified pollution challenges included ambient air pollution, indoor air pollution, water pollution, but the challenges that were identified were mainly those that have significant health impacts. We know that in terms of pollution, we have health impacts, we have environmental impacts, we also have social and economic impacts. But for the pollution, for the HPAP, the focus is mainly on the health impacts. And we are selecting pollution challenges that have a high or a significant health impact. So for ambient air pollution, the challenges identified were mainly vehicle emissions, industrial processes, improper waste management, construction and demolition. And the key pollutants identified were, of course, the particulate matter, the NOx, heavy metals, and volatile organic carbons. And in terms of impacts, it was observed that over 30,000 people in Uganda die annually due to diseases related to ambient air pollution. So that's why we say that those challenges that have a high impact on health were given higher priority compared to others. So some of the proposed interventions include strengthening and expanding the air quality monitoring network and data collection to guide interventions for mitigating health impacts, conducting social pollution studies to identify the major sources of air pollution and to inform management strategies, reduction of open burning and proportion of adoption of cleaner cooking technologies, supporting enforcement of vehicle emission and standards, strengthen the regulatory and institutional framework for management of ambient air pollution. Another challenge was indoor air pollution, and the key causes were mainly cooking with biomass inside houses, or sharing accommodation with animals, or indoor spraying, or dust and mold. Of course, the impacts, these are related to air pollution, but it was estimated that in Uganda, about 13,000 people died due to indoor pollution. And these are the proposed interventions, including increasing the air quality data collection and monitoring, raising awareness in communities, promoting transition from biomass to other cleaner cooking fuels, strengthening the institutional framework for improving. The other challenge is water pollution, And underwater pollution, we had issues of industrial effluents, municipal and domestic waste, agricultural waste, improper solid waste management. And of course, in terms of health impacts, over 70% of disease burden in Uganda is actually attributable to waterborne diseases. And over 50,000 children die annually due to diseases linked to water pollution. So in terms of proposed interventions, of course, there is the monitoring and data collection. There's promoting safe water treatment. There is improving community sanitation systems. There is protection and restoration of degraded wetlands, and of course, review and sanctioning of the water framework. Another challenge was improper waste management. And here we have issues of domestic and municipal waste. And under domestic, the key challenge was the sewage and the fecal sludge management, especially in urban areas, which results into contamination of water bodies. But we have partially treated industrial effluents, hazardous waste from small enterprises, agrochemical runoff, and hazardous waste from health institutions. Of course, in terms of health impacts from solid waste, then you can impact the water bodies, also impact air pollution. And we have a number of proposed actions, like reduction in the quantities of waste generated, reduction in open burning and open dumping, promoting waste to value initiatives, and a number of interventions. The next one was agrochemical pollution. Under these, of course, we have a lot of agrochemical misuse, which includes using agrochemical cocktails, use of excessive application of agrochemicals. There are issues of post-harvest spraying, whereby people can harvest tomatoes and then they spray them to prolong their shelf life. And of course, all these have impacts on human health. And we have a number of proposed interventions in the action plan. And lastly, as a way of addressing the different pollution challenges, concept proposals were developed for each of the identified priority pollution challenges, including ambient air pollution, indoor air pollution, water pollution, waste management, and agrochemical use and misuse. So the proposals were trying to answer the challenges identified and also combining with the intervention that were proposed. So using these concept proposals, which are also an appendix of the action plan, these proposals are intended to be used by the different government institutions to solicit for funding to actually implement what has been proposed. So I thank you all for your kind attention. My time is up. Yeah.
Thank you, Dr. Emmanuel. You may please sit in this on your right-hand side for the panel discussion. Thank you for presenting the HPAP. I will be surprised because I led the program, and to hear you speak about it, it feels different. So thank you. Our next speaker is Professor Francis Pope. Francis Pope is a professor at the School of Geography, Earth, and Environmental Science at the Atmospheric Science at the University of Birmingham. So his intervention will be virtual. Is he ready to present? Okay. He couldn't be here with us today, but he sent his remarks. And also, he actually led the traffic-related air pollution study that we did in Uganda. Francis Pope, if you hear me, you can begin with your presentation.
Thanks, Hannah. Can you hear me okay? Is that coming through okay?
Francis Pope.
Can you hear me, Anna?
So while Sophia is working on it,
Hello, can you hear me now, Anna?
Yes, we can.
Excellent. Shall I start then? Perfect. Excellent. Okay,
Yes,
so
you may begin.
excellent. Hello to everyone. I hope you had a good lunch. Hope you're having a lovely time in Nairobi. My apologies, I can't be there. But yeah, so me, my group and colleagues at Makerere University were given this very interesting problem by this project. So we were tasked with assessing the effect of traffic on air quality and public health in Kampala using low-cost approaches. Next slide, please. So I think everyone in the audience knows why we think about air pollution, but maybe it's worth talking about it quickly. So exposure to air pollutants cause a range of adverse effects on human health. And depending on which estimate you use, it's anywhere between 4 and 9 million premature deaths per year globally. And many of these are in Africa, and many more of them will be in Africa in the coming years as the population of Africa increases rapidly. So air pollution affects many organs in our body. We breathe it in and it affects our respiratory system. Once it gets into our lungs, it can get into our cardiovascular system. And several pollutants are known also to be carcinogenic. Interestingly, not only does it affect our physical health, but there's growing evidence that it affects our cognitive and mental health as well. So if you click one more on, there should be a picture. And so this is an article from The Guardian from a few years ago, but I like it. So it says, air pollution rots our brains. Is that why we don't do anything about it? But anyway, I think everyone in the room is expert on air pollution. So let's go to the next slide. So what's the problems of air pollution control? So we need to understand we need to improve our understanding of the factors that affect air quality. And typically the high cost of instrument usually leads to limited measurements, whether that's limited spatial measurements or limited information on the sources of pollution. But the trouble is the equipment or the standard regulatory equipment is expensive. And so in some locations around the world, it then becomes prohibitive to do this work. Next slide, please. So I think many of you will know, but there's been this real revolution in low-cost sensors. So on the left-hand side is one of these big expensive bits of kit. This is the sort of equipment I would have used during my PhD 10 years ago or so. And, you know, it was very accurate, it was very precise, but it cost a lot of money. And if you were lucky, you would have one of these in your city or one of these in your country, but you couldn't really get much real useful information out of them. And now we go to the right-hand side where we can now buy these sensors, you know, we can buy them online. And they cost considerably less. Maybe they cost $1,000, maybe they cost $100. And they're not as good as the regulatory grade equipment, but with that cost differential, you can buy a lot more sensors, you can take them to places where you couldn't take them before. And actually with lots of sensors, you can start getting pretty good statistics as well because you start getting the benefit of multiple numbers. Next slide, please. Just click it on so we can get all the text. Yeah. So there's been this real revolution in the monitoring of air pollution with these low-cost sensors. And the first step in air quality management is that we need to know how much air pollution there is. Here, the sensors have really, it's been a genuine revolution over the last 10 years. But the next step in air quality management is we need to know where the air pollution comes from. And successful air quality management and control not only requires measurement of the air pollution levels, but it also requires information on the sources and their relative importance. And without this critical targeted information on the pollution sources, it's difficult to reduce air pollution. And so much like the story with air quality monitoring, traditionally source apportionment has been done with expensive regulatory grade equipment, and also it requires experts to look at it. But my group at the University of Birmingham, we've been pioneering this idea of can we do low cost source apportionment, or what we call LOCOSA, but can we use low-cost approaches to actually do the source apportionment as well as the monitoring? And the picture just gives you a kind of a schematic of a city and what sorts of sources we might want to be able to split between. So we want to know how much air pollution comes from traffic, how much air pollution comes from the general urban background, how much comes from industrial, etc., etc. Next slide, please. So the objectives of the project that we were given is to perform low-cost source apportionment to identify the dominant sources of Kampala's air pollution. And specifically, the question was around how much of the air pollution is due to transport-related air pollution or trap. And then once we have this information, to develop a tool to estimate the typical exposure of citizens to trap and quantify the health impacts and inequalities associated with exposure. So here we have a picture of Dimitrios in my group working with Dio Akadi from Airquo, setting up one of these low-cost sensors at Makereri's beautiful campus. Next slide, please. So we set up the sensor network. This was in addition to the Airquo network, which I'll show in a slide or two, but we set up a series of sensors around Kampala, and we set them up at either urban background sites, so these are the blue stars, or urban roadside sites, which are the red stars. And the reason behind looking at these areas is to be able to look at the difference between the roadside and the urban background sites. And the picture is of one of the sites where we set it up. Next slide, please. So this complemented the Airquo network. So Airquo is this low-cost sensor company based out of Makerere University. And it really is world leading. It is very impressive what the team there have done, Professor Engineer and others. So not only do they have this dense network within Kampala, Uganda, but also different cities in Uganda and also different cities around Africa, including Nairobi, where you are now. So really world leading, very, very impressive. But what they do is they just do the monitoring side of it. So what we were trying to do is, could we supplement the monitoring with doing the source apportionment side? Next slide, please. So a few more locations where we put it. And the reason I show this is, and for many of you in the room, these sort of pictures won't be surprising because this is what daily life looks like. But from a UK-centric perspective, the things which stand out is the roads are paved. That's good, but we can see there's an awful lot of this red dust everywhere. And the red dust is from the sidings, from non-paved parts next to the road. And clearly that's going to be a big source of air pollution, dust pollution. But how much, again, is the question here. Next slide. So we measured the PM2.5 concentrations. This analysis is just done over the initial analysis period from December 2025 to January 2026. And we chose this for the initial analysis because that's all within the dry season. We've got more data, and actually the sensors are still running now. So we're almost up to 6 months worth of data now, which is nice. And essentially from the monitoring, we can see that PM2.5 is approximately 2 to 5 times greater than the WHO 24-hour recommendation. So air pollution's high, but we knew that already. Next slide, please. So then the bit that we've done is we do this source apportionment. And I haven't got much time to go into the mechanics of this, but essentially what you do is you take all the air pollution information you have. So some of the important bits are what's the size of the particulate matter and how does that particulate matter co-vary with gaseous pollutants. And so we measure all these things and then we get these different factors out which represent different parts of the air pollution. And essentially factor 1 we attribute to being traffic exhaust pollution, which is responsible for about 27% of the particulate matter in the PM2.5 size distribution during the measurement period. Factor 2 is secondary aerosol, which is responsible for about 8%. Factor 3 is dust, which is responsible for the largest amount, about 54%. But that's not just regional dust. Some of that dust is actually the resuspension of dust from traffic. And then there's this kind of more urban background source, F4, which is responsible for 11%. And if you look over the different sites, the 6 sites we looked at in detail here, we can see the relative ratios of the different sources change as you move through the city. Next slide, please. And so what we can do with that dust factor, remember it was 54%, is actually we can look at that and do a few more mathematical tricks, and we can try and separate that dust into both regional dust, windblown dust, and also the resuspended dust from the roads. And actually when we do that, we can estimate F3A, which is the windblown dust, and F3B, which is the resuspended dust. And actually when we put all these things together, we end up with, and then we can answer the question of how much air pollution is due to traffic. So PM pollution coming from the exhaust is about 27%. Resuspended from the traffic is about 39%. So we can see the vast majority of our measurement sites for the time period we were looking at is due to traffic-related air pollution. And that's an important result. We knew that, but we couldn't quantify it before. And then everything else is responsible for about 34%. Next slide, please. So the next bit we did was we developed a health dashboard, so we could then put in these numbers, how much air pollution is there, how much of the air pollution is responsible from traffic related, and then we could estimate the deaths, the life years lost, etc., etc. And then we could say, you know, in terms of how do you want to reduce air pollution? How do you have your biggest effect? And so by reducing traffic related air pollution. Okay, we could do various scenarios on top of that. Next slide, please. And so we've shown that this low-cost source apportionment. So now we can really show how you can implement this into clean air interventions. So if we start at measure air pollution, so that's what the sensors could do anyway. So we measure the air pollution. We can now identify the sources. If we know the sources and we know the air pollution, we can then estimate the health effects. So we can then plan the intervention, and then using the same sensors and the same source apportionment and the same health effects calculator, we can then evaluate the intervention, and we can keep on going around this circle. But now you've got much more power to know what is causing the air pollution, where you should be putting your interventions, and how to measure it. So I think you've now got this really nice tool which can be implemented in many places around the world, not just limited to Kampala, not just limited to Uganda, but actually many places this will be very important, and not just in the global south. Many places in the global north need this information as well. Next slide, please. So just to summarize, really, low-cost sensors allow us to measure air quality in multiple locations throughout a city. The low-COSA approach allows us to estimate the dominant sources of pollution in a hyperlocal way. The air quality tool, the health tool, can use that sensor and that source apportionment data to estimate the health effects that can be attributed to different sources, in this case, traffic. And there's really great potential to scale this work to support targeted place-based air quality and health actions. So the final picture on the right-hand side is my way of trying to show that actually increasing the scale of the project, yes, the sensors in the blue will increase linearly. You might get some discount if you buy lots and lots, but actually the setup costs and the analysis costs stay relatively stable. So I think there's great potential really now to go in many different places and reapply this technique for not that much more money. Next slide, please. And that just leaves me to say thank you for listening. I'm very happy to take any questions on the panel later. If you want to get in contact, that's my email. Many thank yous to the co-authors, GAHP for funding, DFID, UK International Development for funding as well, Makerere University and University of Birmingham. And with that, I will stop. Thank you.
Thank you, Francis Pope, for this wonderful presentation. If we have any question, we'll let you know because there will be a panel discussion in the next 30 minutes. If you could please stay online for any additional question. Thank you. So our next speaker is Dr. John McCosh from the Institute of Natural Resources. Sir Epa, give us 1 second. Thank you.
Thanks for the promotion, but I'm not a doctor, I'm a mister.
Okay, thank you.
My colleague Nick, however, is a qualified doctor with a PhD. Thanks. So Nick and I are going to do this presentation together, and we're going to do different aspects as we move through it. But really, it's to talk about the environmental pollution program and the work that we've done in South Africa over the last 3 to 4 years. And yeah, I think it's been a really interesting journey, and I hope you enjoy the presentation that we're about to do. But really, it's about tackling the triple planetary crisis and lessons from the EPP in South Africa. As we all, whoops, okay, that's the wrong one. As we all know and have been told many times today already, we have this triple planetary crisis. We've got pollution, biodiversity loss, and then encompassing it all, this threat of climate change. And I'm sure every single one of you has a harrowing and often tragic story related to climate change that was possibly exacerbated as a result of pollution and biodiversity loss. So I don't think there's any need to go into any great detail at this stage. But emerging from this challenge, the EPP was established, and ultimately it recognized that pollution is part of this triple threat. And the idea was to do some scoping across, I think it was 6 or 7 countries, and ultimately there was focus on 2 countries, South Africa and Vietnam. So one of the things that we had to do was to understand the problem. As Maria said right in the beginning, before this workshop was initiated or this forum was initiated, a survey was done to understand what stakeholders wanted out of it. And we had to do something quite similar in the work that we were doing. So we had a scoping exercise to understand some of the major challenges. Because without understanding stakeholder needs, we run the risk of presenting solutions based on desktop data that we just throw at a problem and is not necessarily appropriate. It's quite comforting in a dystopian kind of way that South Africa faces exactly the same problems that all the other countries that are presented today. So there's not much that I can add here, but again, water scarce, high levels of pollution, issues with governance, a high Gini coefficient, which is an indicator of income disparity. So yeah, we face a lot of challenges. And emerging from this work, ultimately, we came up with 3 focal areas for the program. The first was around modeling, and really modeling wastewater impacts in rivers because water quality emerged as one of the major challenges. We looked at 4 elements, which was air quality, noise pollution, water quality, and solid waste, and ultimately, all in the context of biodiversity. And ultimately, we ended up focusing on water quality and solid waste. So it was important to understand what happens to wastewater in our aquatic systems. So that was one element of the work. It was looking at the impacts of solid waste on wastewater, including changes in carbon storage and the life cycle of waste as it travels to the ocean. You know, all these systems are connected, and we know that they're connected through water. So something that happens in a terrestrial system will equally have an impact on a freshwater and ultimately on a marine system. And then finally, which is sort of the work that we do as a relatively small applied research NGO, is working with communities to test local solutions to some locally identified pollution problems. So the whole idea was that the suite of 10 programs that were implemented were sort of considering local challenges, local to regional issues around water and catchments, and then also considering national. I'm going to talk about 2 of our very localized programs, but before I do that, I'm going to hand over to Nick to talk about the work that he's been doing in on solid waste and the environment. Thank you. No need to clap, I'll be back.
Which is the down arrow? The down arrow is the critical one. Okay. Sorry. Yes, thank you. Okay, so as my colleague John said, I'm the doctor, Nick Rivers-Moore, and my background is in aquatic ecology and water quality. And 4 or 5 years ago, I had this wonderful opportunity to enter right at the start of the scoping phase of the JNCC managed EPP, and worked through that. So I'm going to jump in at this point. This slide is more just as a placeholder to remind me now. In the project, our focus coming out of the scoping phase was to look at solid waste and wastewater, but how that related specifically to the freshwater environment. So it had a very clear
it's a pollution source and then the receiving environment. And I think that's one thing that comes through in all we do. And in this case, for example, the slide on the left is a wetland in the Southern Cape of South Africa, where there is just this lovely name, Kleitjieskraal, but it's just got all this. There's an informal settlement, there's dumping going on, and ultimately, be it solid waste, there's a lot of nappies in there, and John will touch on that. Mix of solid waste, it could be chemical pollution. So whichever pollution enters the environment and then through catchment geomorphology, rainfall, flood events, etc., it ultimately, especially if it's not managed, it ends up in the water courses, and then ultimately into the marine environment. Now that one again, that's a really horrible river outside Cape Town, where there's a litter boom going across portion of the channel. But again, that's almost the last ditch attempt to deal with the problem that started higher up in the catchment. What we did, and we've got a similar process for wastewater, is we needed to understand the solid waste cycle. And that's an issue that I've seen coming out in the talks today already. And again, the detail is not critical here, but it's more a case of, this was used as a stakeholder tool as well, so that people could see where the sources of waste are and how they relate to, let's say, the target approach. So in this case, our focus was freshwater systems. So it's how does solid waste relate to freshwater? What are the pathways, etc.? And that was a very useful tool for stakeholders that I'll touch on just now to position themselves in terms of, okay, I fit in, or my industry fits in here, and it relates to other businesses along the way. So this was used as a pivotal thing in workshops that we had, specifically designed to identify research gaps and prioritize those relating to solid waste and wastewater. But I'm only going to be presenting on the solid waste here. And we've spoken a lot as well, the gaps also relating to the importance of data collection. I'll touch on that, but that, yeah, it's between evidence and policy. All right, so to touch on the evidence briefly before I get into the gaps, and this was jumping around a bit. This was that arrow that John showed, more the national. The project was aimed at also looking at scaling up issues where possible. And in terms of high-level evidence, and this is something I think that the whole air quality from traffic has come out as a critical issue. But something else that hasn't come up yet, but it's related to that, is the whole issue around tire wear, particles, and the pollution. So every time a car brakes, the way people drive, all of that stuff goes into the environment as well. And so here the evidence was to design or to conceptualize where is that pollution coming from. So that whole flow chart, and that was translated using GIS modeling into a national hotspot map to say, okay, in terms of tire wear, particle pollution, where are the hotspots in the country? So that then informs it, it breaks the problem down into something a little bit more manageable. So that was the evidence process. We also wanted to look at what the research priorities were, because I think with pollution, it's such a huge problem that it's difficult to know where to start. So it's helpful to break this down. This came out of our 10 projects and the project teams, where we ranked and voted for different research priorities as perceived by the team. And that helps again, possibly in terms of applying for funding and engaging with stakeholders, where we identified, what was it? Yeah, 10 projects across 3 domains: societal priorities, changing human behavior, solid waste issues and wastewater. And by far the biggest one that came out was fate of pollutants. But yeah, I'm not going to go into the detail there. That dovetailed with a process where we engaged. We had a directed approach dealing with stakeholders from government sectors, private sectors, NGOs, etc., for solid waste and wastewater, as well as targeted interviews with specific experts. And coming out of that, and our project team, we identified priority gaps across policy, research, etc., for solid waste and wastewater. Now, this one, again, the detail is not important. The red writing, the numbers indicate the projects in our EPP that related to specific research gaps. What's important here, two messages, is one wants to target or to identify research priorities that have stakeholder buy-in, and we rank them in terms of what is the timescale to achieve these versus the relative impact or leverage of those projects. So ultimately, one is looking for high leverage, high impact projects, but in many ways, a lot of these priorities all link to each other, and one could start with short time frame, high leverage projects. So it's just a way of ranking how one targets research projects. All right, now those research gaps we fed into what's known as a theory of change framework, where on the right-hand side, one defines what is the outcome, so be it clean environment or something, and those research priorities were then fitted into this framework. Again, the detail is not important, where one can see, okay, if I do this, it's going to achieve this, and it'll lead to that. So, and all of this, I've got two PDF documents that I can make available through the workshop that give more detail on this. All right. And then the next, again, the detail, I'm skipping over the detail, fitted into what we've called a transformation map of actions and outcomes. So it kind of builds, it's the step of the gaps, the theory of change, and then the actions using this transformation map, where one breaks it down into short, medium, and long-term projects. What are the metrics used to measure success? Who should be involved? Various factors. So it gives quite a nice roadmap of these are the practical steps. This is what we need to do. These are the government departments who should be involved, etc. Now, our biggest Achilles heel is that this hasn't found a receiving champion within government departments, but the steps we've used are robust. I'll hand you back to John. There we go.
Thanks. Thanks, Nick. So I'm just trying to keep an eye on the time so we are equitable in our own internal time allocation. So I'm going to talk about two very local level projects that we did as part of the EPP. One is this one here, which is around nature-based, community-led approaches, spring protection interventions, addressing pollution, and from improper waste management, improving water quality. But essentially, it's about engaging and working with communities to understand many of the risks that are associated with water use. In South Africa, I think it's a large proportion of our rural households rely on springs as their primary or secondary source of water. And when I say springs, I'm not just talking about springs that are artesian wells, mountain streams, rivers that are used to capture water. But in many cases, landscapes are degraded, they're polluted, which can present risks such as from livestock trampling, contaminated surface runoff, pollution, poor management of broader areas. Earlier we were talking about, the impact of pesticides and agrochemicals and over-fertilization on the water table and groundwater, and that's something that we also had to be concerned about. And again, as we know, contaminated water, particularly that which has diseases in it, is responsible for a lot of disease. I think 80% of diseases and 50% of children deaths are attributable to water issues. So really what we wanted to do was to work with for communities in 2 separate areas to identify and catalog springs that they worked with, analyze for specific pollutants, and then work with local water users to co-identify potential solutions. This is just one aspect of the household surveys that we did, but really the point is to show that all the households, 100% of respondents indicated that they relied on springs or non-potable water sources for their daily household use. So through processes of multiple stakeholder engagements with the spring users, we then co-identified potential solutions. These could have included weirs or V-boxes that would limit the amount of sediment entering into the water sources, using storage tanks to enhance water security where water flows were low, and in some cases, reticulation of water to the household where springs were very far away. The main concerns around water quality were largely around coliforms and biological indicators. All of the interventions that were implemented did lower the presence of coliforms, but did not bring them down below permissible levels. So we had to engage with the communities to explain the risks and concerns and make recommendations about how they could potentially address these issues when using water from the springs, such as disinfectant, boiling, use of bleach, etc. In some cases, we found that there was nitrates, and in one case, aluminium was also a concern, but by and large, it was coliforms. Then the other project is community-led waste management. And here, what we sought to understand was to look at the composition of waste across a gradient of urban to rural. So we looked at 3 areas: a deep rural, a peri-urban, and an urban area, to really understand the types of waste that were being generated, how waste was being managed in each of those locations, and work again with communities to co-develop solutions around how to explore alternatives. So again, it was a very participatory process, lots of workshops and meetings and engagements with communities, cleanup days and practical demonstrations to raise awareness about alternative uses of waste and how to sort of valorize waste at a local scale. And ultimately, what we were finding, the key differences was across this rural-urban divide was around participation, context and practices, stakeholder engagement, education and involvement. And across all cases, we found that the engagement and participation and support within the urban context was a lot lower than with the rural counterparts. Rural communities were a lot more engaged, they were a lot more active. We had good support from traditional leadership structures. So again, you know, I think a lot has been said about the role of government, but also an active citizenry is very important in terms of ensuring that there is engagement between policy, legislation, and structures of government. A few observations and lessons and recommendations from this action research. I've already talked about rural dwellers. Generally, fewer opportunities, more reliance on natural resources indicated that there was more awareness and consideration for how to manage the environment. Solutions require behavior change from all stakeholders. We found that when we had local champions and supporters and advocates within the communities, it worked a lot better. We also need support from government. We engaged a lot with local government structures and even provincial government structures, but we found the buy-in to some of our ideas was not as positive as we'd hoped. And so, you know, but at the same time, we did try and engage in partnerships and support collaboration. And, you know, working with government did boost credibility, and we did find that urban areas need stronger links between residents and municipal water services. But I think for me, the most sort of, the aspect that stood out the most for me was the disparity between the policy that was developed at a national scale and the realities on the ground. And I think we really need to think very carefully about how this is done. For example, municipalities are water service providers. They are supposed to provide potable water to rural communities. At the same time, they receive infrastructure grants from government, which then represents income to the municipalities, and rural municipalities tend to have very low levels of income. So they're incentivized to apply for infrastructure grants, capital intensive, requiring maintenance, whereas perhaps that money could have been better spent supporting better spring management at a local scale and decentralizing how the system is managed. Yeah, and similarly for waste collection, the Department of the local municipalities are mandated to provide waste services. They can't. We tried to come up with a whole lot of locally based alternatives, but they were outside the legislation, so therefore couldn't be supported. So there's this conundrum that we have to really continue to engage around. Okay, now Nick, you're going to have to fly for the last Thanks.
You did. How much time have we got? 1 minute. Thanks. Okay. Thanks. Okay. Very briefly, these are the conclusions. Again, we can go through it. It's in that PDF. We've touched, and this is just to emphasize, we've touched on the link between data and policy, and conceptually we developed this idea where the weight of evidence is important to inform policy, which goes into decision making. I just want to touch on the central thing where one has to weigh up the relative risk of taking a decision without the data versus the risk perhaps in not taking a decision. So it also relates to data certainty, data availability, data platforms, but all of that linking in with policy. This was just a slide we can always return to in terms of the outcomes of the EPP in South Africa across various metrics, which is more for reporting, I guess. I'm really skipping through here. We looked at, and I think this is the take-home message now is about, for any of the programs, is about thinking about the program legacy. So it's not just within the project, for example, the Ugandan EPP that we looked at. It's the life cycle of the project within, beyond the project in terms of what is the legacy and how does that get sustained. So that's the real take-home message there. Some of the priority policy recommendations, which are in the report with all the detail, were, and again, it's repeating what we've heard, the need for stronger institutions and partnerships. So that's private-public partnerships, strengthening institutions, and again, that's where the data comes in, that's where the research gaps can help fill. You might address one issue that helps to strengthen an institution. Increasing public awareness around the health risks of, in this case, solid waste. And another one, climate change links between solid waste and flooding. So the public should be demanding accountability as well from governance, which I suppose leads into that. The need for consequence. So what happens when a municipality fails to provide what it's mandated for? There need to be those feedbacks. And that, I think, it sounds it's a challenge across the region. But also the whole economy and jobs, income based on the pollution conundrum. So recycling of e-waste, etc. And with that, just to say thank you to our sponsors, our JNCC team, the colleagues. The reports are in the process of being uploaded on that website. And yeah, it's been an absolute pleasure to be part of this forum. So thank you. Yes. Yeah.
Thank you, John and Dr. Nick, for this presentation. So thank you to all our speakers, Dr. Emmanuel, Dr. Nick, Francis Pope, and John for this wonderful presentation. Now we will move forward with the Q&A. I would like to ask one question, and then if we have questions from the audience or the online participants, so that you may answer the specific question you have. Based on the success stories, what is one scalable mechanism or policy that has effectively reduced pollution exposure or improved environmental health, which could be replicated? Please provide one example in your response. Okay, let me reread the question. Based on the success stories, what is one scalable mechanism or policy that has effectively reduced pollution exposure or improved environmental health, which could be replicated into other countries? Please provide an example.
So one thing that emerged from the solid waste that we did in the peri-urban areas was we did an analysis of the cost of recycling and transporting it to where the recycling depots were, and the transport costs threw the whole economic model out of the window. But there is a national program called the Presidential Employment Stimulus Program, PES, but not Ecosystem Services, that sort of provides opportunities for youth to learn and to do short-term employment 5 days a month. And that helped to offset the costs of recycling the waste. And it talks to a very important point, particularly in rural areas where transport is a burden, is that in some cases we've got to recognize that while we can't provide full-on waste services, you can offset some of the costs through these kind of programs and can potentially be upscaled because it recognizes that there's environmental benefit, there's ecosystem services that are emerging from these cleaning programs.
Thank you. Dr. Emmanuel, would you like to answer?
Based on the different interventions that were proposed to address the different pollution challenges, one key intervention I can think about is the issue of data collection. Expanding capacity or infrastructure to collect data related to pollution, because you need to inform monitoring, you need to inform decision making, you need to inform mitigation measures. So whether you are expanding capacity for the duty bearers to monitor, or you are expanding infrastructure for you to be able to collect data about pollution, or you are carrying out studies like social apportionment to inform the different sources of pollution, this is critical in order for you to enforce regulations, to monitor pollution, to save or safeguard communities. Thank you.
Thank you, Dr. Emmanuel. Would you like to answer?
No,
okay. Will Francis Pope like to answer? Is he still with us? Okay, he can go
I'm here.
ahead.
Can you hear me okay, Anna?
Yes, I can hear you.
Excellent, thank you. I think in terms of actions which can really improve air pollution, I think it hasn't been a complete action going forward, but in terms of being able to plan these interventions, this suite of low-cost tools that our project and other projects have developed really does mean when we have limited funding, and everywhere around the world has limited funding at the moment, it really means you can pick the best options with the best information. So I think there's lots of potential here to really optimize the funding, where to put the funding successfully. So I've got really, really hopeful about how this low-cost source apportionment will revolutionize how we look at air pollution in different cities.
There is a microphone right behind you.
Oh, okay.
Yes.
After you then. Thank you very much, our presenters. My question goes to Dr. Francis Pope on the air quality sensors. I wanted to know the capacity for measurement. Do they only measure the PM 2.5, or there could be other parameters that these low quality sensors can measure, or are you exploring in the event that they can only measure the PM 2.5? Are you exploring options for measuring other particulate matter? Then how affordable are they, the low-cost sensors, and can we readily access them? Thank you.
Yep, thank you for the question. So the first answer is what pollutants do we look at? So the sensors that we're using are air gradients, and so they measure PM 2.5 is their primary thing they're interested in. And that makes sense because if we look at where those millions of premature deaths come from globally, it's because of PM inhalation, PM 2.5 in particular. But they also give estimates for gas phase concentrations for NO2, nitrous dioxide, for ozone, and for volatiles. And so whilst the low-cost sensor community is reasonably comfortable with particulate matter measurements, gas phase measurements are more difficult to calibrate. But for what we're doing with the source apportionment, we don't actually need absolute numbers for the gases to help inform the source apportionment. So I'm not too worried about that. The PM 2.5 measurements are good. We've done calibration in country in Uganda. We've done calibration elsewhere, and they tend to work very well. So I think going forward, the primary endpoint should still be PM 2.5, but gases are important. They also cause morbidity and mortality. And then the second question was around the cost of these things. And the cost is being driven down by some really good operators. I don't feel like it's my job to advocate for a particular company over another, but you can get some really good measurements for PM 2.5 in particular now for sub a couple of $100. So, you know, it really is pushing it down very nicely. So there is great scope to increase the coverage. And as I said in my presentation, actually the cost for scaling, the cost in terms of sensors is relatively linear, but the cost in scaling in terms of the ground support and the analysis is much less than that. So there are real advantages for scaling there. Thank you.
Thank you, Francis Pope. Just one more question, and then there will be opportunities to interact with the panel later on. Okay, yes, please, sir.
Thank you. My question is good to Dr. Pope or Professor Pope. Just wanted to clarify the source apportionment. It's for ambient air pollution, not necessarily indoor air pollution, especially given that, you know, biomass fuel consumption at the indoor level causes a lot of pollution, you know, indoor. Just wanted to confirm that it's largely what we're looking at is for the outdoor ambient air pollution. And then also for Ron, I just wanted to thank you also for your presentation, Nick and John. Sorry if I didn't get the name right. You talked about, you know, looking at the pollutant, and you mentioned the E. coli or coliform, you know, pollutant, which is largely biological pollutant. So you just was wondering, did you also look at, you know, potential for heavy metal contaminant or pollutant in this regard, since most of these pollutions come from improper disposal of waste, and you'll agree with me.
Sir, can you please go straight to the question?
Yeah. So I'm just saying, you know, did it, that's the question. That's the question. And I think you got it. For other, you know, heavy metal pollutants, you know, beyond the coliform.
Yes, we looked for selected heavy metals. I can't remember the full range, but lead was definitely one of them. Yeah.
Okay, thank you. And there is a question for Francis Pope.
Yep, so the question was around source apportionment, were we looking at ambient or indoor? And so in this particular study in Kampala, it was about ambient air pollution, but we've applied very similar approaches for indoor locations as well. And obviously, or maybe obviously, a lot of indoor pollution actually is outdoor air coming in. I mean, there are other sources within there, as you mentioned, biomass burning, etc. But yeah, we can do the source apportionment. And the nice thing there is you can say how much of the air pollution within the home is to do with outdoor air, is outdoor air ingressing with indoors, and how much of it is due to indoor air pollution. But please do get in contact. Anna can give you my email if you would like, and I can send you links to that. that work.
Thank you, Francis Pope. Just so you know, the presentations will be available after the forum as the pictures and everything else. So you can have more time to go through them or to speak to the different presenters during the rest of the session tomorrow and also tonight during dinner. Thank you. So I would like to once again thank our panelists for this wonderful presentation. What I gathered from your presentation is that from the different projects that you've done, whether it's low-cost sensors, chemical monitoring, health and pollution action plan, that success is local, replication is possible, but the conditions needs to be met because the different countries or the different localities have different conditions, whether it's temperature, whether it's relation with the ministries, the local government, and everything. Coordination is key. We need policies, we need financing, we need data, which has been emphasized by Dr. Emmanuel and also Francis Pope, and we need partnership that works. So thank you all. While we are at the end of this session, I would like to tell you that we have a short break of 10 minutes. So it's 3:48. Please be back here at 3:58 so we may begin the next session. So the coffee break is right in the room on our right-hand side. Thank you. Thank you, guys. Your coffee break. So since you have 9 minutes now, I think we should get moving.
Messages are coming through.
Yes.
So cross countries. So that's
This one's.
so yeah.
These two, can I copy them into your desktop and then we
Use the choice yours. As long as you, because it's like a draw. When you play, you can find it back. If you count on someone to tell you where it's in your draw, you're not.
Yeah.
Yes, I'm just trying to move two things. This into
Too much.
Maybe too much. As usual. Generally, these things, it's always it's break. All you do is eat.
Okay, so now we can remove it.
I think no, I'm using.
Welcome back, everyone. Welcome back, everyone.
That's pretty well. You have the group. Convention. Okay. So we're one more director, one more people, and percent stuff. I have been yes. So I.
Yeah. Welcome back into the room. I'd like to take a seat so that we may begin with our almost final session. Where is the rest of the room?
Everyone having some coffee?
Okay, welcome back, everyone. It's 4:02, so we would like to begin with the next session. I feel low energy in this room. Can you hear me all right? Can you hear me? Can you give me your attention for just 2 minutes? Thank you. Okay, so this next session, I hope you've enjoyed your tea break. So that's the first thing. So I would like to invite Sophia Lopez Alvarez, who's our program associate at GAHP and the wonderful planner behind this successful forum. So let's applaud for Sophia. We've seen your 120 emails and the hard work you've done. So thank you for this. And so she would like to walk you through the guides for the group session. Please give her your attention as she will be mentioning very important information. Thank you.
Hello, everyone. Thank you. We will now be divided into the 4 groups for the working groups. We have air pollution, chemical pollution, waste minimization and waste management. And as a surprise, we added a water pollution group. So if anyone wants to join that one, you're very welcome. So now we ask you to please rearrange yourselves in the groups. We have the 4 moderators. So for air pollution will be our great Soraya from UNEP. She's at the back. Chemical pollution is Dr. Achaye over here. Waste minimization and waste management is John there. And water pollution is Dr. Nick. Yes, excellent. So the structure is there will be 1 moderator, 1 note taker that has already been assigned, so you will have some help. And then at the end, there will be 1 presenter that will present all the findings for 10 minutes to everyone. Thank you very much. If you have any questions, you can always ask any of us. Yes. Yes, so please go to your groups. Thank you. Anyone for air pollution, please follow the lady in blue at the end. We can sit there, yeah, we can. Yes. Air pollution at the back, please. Waste in the coffee room. And chemical pollution stays here with. It's not true.
Can you hear? Okay, this one works. Sophia, are you ready? Okay, so since the presenter from the air pollution group is very eager to share the discussions, so I would like to invite him over to come so that he can present himself while Sophia is putting up the slides. I know you guys finished first and you guys went really strong on it. So we look forward to hearing what was discussed. Yes, please. I have a message for you. This gentleman just told me that you need to rush because he wants to go to dinner. Because dinner is at in an hour. So, and they have 10 minutes each, so that's 15 minutes. When they call him. So once it's up, just and he'll just at the top.
Okay, you can have it here. It's the thing that we're no, it's just like, so for him to have all the notes and but we're gonna project him. So this is everything that I want to show up.
Any ideas? Okay. Yeah,
Good evening. I will be presenting on behalf of the air pollution group. Could we settle down before we begin? Okay, great. Thank you. Thank you for your attention. My name is Washington Kanyangi. I serve at the Africa Research and Impact Network. I'm into adaptation systems, focusing on food systems, urban resilience, as well as climate finance. So in our group, we structured our thoughts across monitoring public health action, where we looked into data, policy-driven action. We looked at transport and air quality. And lastly, we looked at why this data and yet we have minimal action when it comes to mitigating air pollution in Africa. So starting off, we had some success stories. Could I continue when the, okay. First, we had some success stories in data and policy driven action, and that is in Tanzania and in the context of waste management and sanitation reforms. They've had some work going into developing the national waste management strategy, which was supported by Sweden. Then again, there's the aspect of a strong collaboration kind of working mechanisms between the ministries, national ministries, as well as the local governments. Also, there's the aspect of nationwide sanitation and environmental greening campaigns that are ongoing periodically for effectiveness. Then the policy requirement for households to construct modern toilets has improved, has reduced open defecation and improved environmental conditions. Also, this one speaks to matters to do with health, water pollution, etc., etc. So some of the enabling factors towards this is that is the political buy-in into the processes. Also, there's a clear mandate under the Environmental Act in Tanzania for that matter. Lastly, there's the aspect of multi-sectoral implementation involving local authorities. So, which means that the impact is trickling down to the grassroots level. Then there's a case study in Côte d'Ivoire that is in transport and air pollution measures. Number one, to mitigate air pollution from the transport sector, there are restrictions on importing older vehicles. So there's a limit, 5 to 10 years. Also, there's the aspect of investments in public transport mobility. Also, aspects to do with investments going into expansion of air quality monitoring and local sensors. We are talking about mobile laboratories and the anti-pollution centers that have been envisioned to convene effective interventions that can be scaled out to vulnerable contexts. Then the enabling factors here, one, of course, regulatory actions that are being enforced effectively, regional cooperation throughout the ECOWAS region, government engagement with the industry stakeholders, transport stakeholders, etc., etc. Next slide. Yep. One back, I think so. Yes. So why has data not led into action? Number one, air quality monitoring exists in several countries, but policy responses remain limited. Number one, because there's weak enforcement and compliance mechanisms. Number two, we have limited integration of health and air pollution data, which also links to fragmented institutional responsibilities. So there's that aspect of siloed approach when it comes to mitigating air pollution in our cities, in our urban areas. Lastly, there's the aspect of financing constraints, and this comes in a moment whereby the climate finance is really shrinking. Then again, we should talk about how can we, get the relevant actors to invest in infrastructures that are going to mitigate air pollution. So I'm talking about the private sector actors. How can we package the information to them that if at all you adopt green energy into your economy, your operational expenses are going to be minimal, then what does that tie into your return on investment? So we should be able to build a logical case to them so that they can, see a sense of mitigating. I've seen you. Then lastly, concerns about data quality is also an issue. Then the key takeaway here is that data alone is insufficient. Action occurs when monitoring is linked to governance structures, health evidence, financing mechanisms, and enforcement capacities. I think, okay, yes, the bottlenecks. Yeah, I think it's one slide back. So the existing efforts that are there to have an effective policy frameworks. Of course, there's environmental laws, waste plans, and that involve multiple ministries. So the aspect of bringing stakeholders together in policy making processes. The air quality monitoring centers should be invested into. Regional efforts is very critical in this context. Of course, the key bottlenecks, we have governance, data, financing, coordination, aspects that I've just mentioned before. And our core message is data and institutions exist, but impact is limited without strong coordination, financing, and enforcement. I hope I kept.
Yes. Thank you for the presentation. I was gone for most of your presentation, but I'm sure the audience was delighted to hear about the discussion that went on in your group. Now, the next speaker Sophia, who's next? Chemical pollution. This is the group that was coordinated by Dr. Achaye. And who's the presenter from this group? Dr. Emmanuel. The dedicated note taker. Actually, this group took longer than any other group and complained that I didn't give them enough time. I'm spilling all the teas. Okay. You have 10 minutes out.
Thank you very much. I'm here to present the report from the group that looked at chemical pollution. And the first task was to share a specific multi-stakeholder initiative that successfully reduced or eliminated hazardous chemicals. And for this, we picked a multi-stakeholder approach in the reduction of lead in the consumer products. Here we're looking at products like fuels, paint, and food items. And of course, these have different levels of success, but can help us to illustrate for this discussion. So which sectors or partners were involved? We're looking at government MDAs, including environmental agencies, including standard agencies, including relevant government ministries, academia, industry, private sector, consumers, NGOs, CSOs, development partners like WHO and the rest. So was it national or local in scope? Of course, this is national, but it can go beyond national to go to regional and international when we look at issues of fuel. Next slide. So what factor was most critical to success? So for example, for the reduction of elimination of lead in fuels, the regulatory and institutional frameworks were critical to ensure that this is done, but also the same tone can be said for lead in the paint industry, even though we haven't yet gotten complete elimination, but there is also the government political will to enforce and regulate, but also stakeholder engagement and coordination. So what measurable environmental or public health improvements resulted from the initiatives? So one key measurable output of this could be the elimination of lead emissions from fuels, because since all leaded fuels were phased out, then elimination of lead in these fuels is completely eliminated. Even though for other sectors, we still have some issues of lead. Lessons learned: what incentive, regulation, or enforcement mechanism was most effective in phasing out of the hazardous chemical? Here we're looking at the multi-sectoral approach in the enforcement or regulation of lead in fuels. Then what challenges did you encounter? Mainly, some of the challenges in the lead industry is the informal sector, people who use lead in the formal sector. For example, in the paint industry, paint formulations are still existing where they're using pigments that contain lead. There is lack of awareness, and also there is gaps in enforcement. Next slide. So how important was public awareness and industrial engagement? Of course, we are saying that this is critical because some of the stakeholders actually are not aware of the dangers of lead in the different value chains. For example, lead in the paint industry, or lead in fuels. So public awareness is critical to reduce lead in these value chains. Did cost or technical capacity limit success? Of course, cost comes in rated highly, because when we look at lead in the paint industry, replacement of pigments, the inorganic pigments with organic pigments, there is an issue of cost because usually the inorganic pigments are cheaper compared to the organic ones, but also the technical bit of it involved in the reformulation of paint is also an issue. The next question is similar, that the financial constraint or limited technical capacity affect, so this one we can skip. What has been the biggest challenge in securing multi-sector engagement in the elimination or reduction of hazardous chemicals? We looked at poor coordination amongst the government MDAs or regulators, but also the issue of segmented mandates, because sometimes people are managing different value chains of these industries. How were the responsibilities divided across agencies? So we looked at streamlined institution mandates and collaboration between. I have 2 minutes and we are concluding here. So did the formal agreement or partnerships help? Of course, yes. For example, in the paint industry, some manufacturers have made partnerships to produce lead-free paints, and they even certify their paints that are lead-free. And in a way, they access a good market that are interested in lead-free paints. What strategies would you recommend to improve coordination? We are looking at improvement or enhancement in financing, streamlining mandates between government institutions, and creating a national center or coordination center to ensure elimination of specific hazardous chemicals. Thank you.
Thank you, Dr. Emmanuel. This was the presentation from the group on chemicals. So next we have my group. Water pollution, water is life. So we will have a presentation from the moderator of the group. Thank you.
We're setting up a pattern here. Okay.
Okay.
All right. Thank you. It's all right. Do you want to present? Are we okay? So we looked at water quality, water pollution, and so the questions were we kind of used them as a guide, but worked around some wider issues because it was quite a difficult one to pin down. But what we thought we'd start with is the recognition that river catchments very often don't align with government boundaries, district boundaries, or even countries' borders. So in that case, yeah, might be within one country, the river flows between two provinces or districts and or across multiple countries. And so I think it's important to frame the issue of policies around that, because policies often might just relate to, yeah, what won't necessarily align very well with the river itself. So that's just one thing. Oh, sorry, I don't know if we. Yeah, and yet, but we did come up with a. I don't know if my other team members are welcome to chip in on that. We did identify an initiative for Lake Victoria that encompasses 3 different countries, and that demonstrates that it is possible to monitor and do transboundary management with success. So that was a success story. Okay, next one, please. Again, yeah, examples of success we presented. We had a number from the different countries. Ghana, the Water Resources Commission, and I've got to be sure because South Africa, we've got the Water Research Commission, but yeah, different things and policy around pollution arising from illegal mining. And that was a common issue across, in fact, across all of the countries. So their heavy metal contamination getting into the rivers, also misuse of pesticides,
poor waste management filtering through into people's drinking water. And that public databases have been developed for that. But again, it's data are there, but not necessarily the consequence. South Africa, our legislation makes provision for something called resource quality objectives, where there are numerical guidelines that have been gazetted in theory for managing water quality and quantity, but this doesn't always translate into something meaningful. And then we highlighted from the talk content that John gave, the EPP's Community Springs interventions as a successful, perhaps not this, which could feed into policy as well. Mali, Anna raised the issue of pesticide, residue from what is it, drums, pesticide container drums that are misused, and perhaps a lack of accountability going back to the cotton industry. That's a big user of pesticides. Just and associated environmental risks that would be across multiple sectors. And then in Kenya, civil society campaigns were seen as a positive outcome to raise awareness and promote recycling rather than just random dumping. So it's more a solid waste issue that damages the rivers, but probably associated water quality, and community waste collection projects that also offer income opportunities to the waste collectors. So we've touched on that link between waste and job creation. Okay, next slide, thanks. Then we looked at some of the challenges around it, where policy perhaps exists, but it hasn't followed through. So certainly from the South African example, a lot of strong policy frameworks, but weak enforcement and implementation. And that we have historically had fairly good water quality monitoring initiatives nationwide, but these programs haven't been that sustainable. So it's kind of, the data just sits there. How much longer have I got? Yeah. Ghana, difficulty translating monitoring data into action, and not specific to Ghana, that it's what we find as well. Resource constraints within local authorities. So it's same themes coming out, and then a number of sector-specific challenges that feed directly into certain water quality issues. So illegal mining, insufficient regulation, insufficient enforcement of regulations, but building too close to river banks and water quality deteriorations there, pesticide runoffs in Mali again. So. Okay, so I think it all really circled down to, again, the themes coming out. Policies alone are, no matter how good they are insufficient. It's about enforcement and implementation capacity. And then the issue, because some of all the different tiers of government and the policy is not likely to succeed unless there's coordination within, across the different tiers of government and between different government departments, because often water management is segmented across different departments. And then, of course, the feedback loop, that monitoring data must link back to say, we've picked up a problem, there's a trend here that relates to so-and-so who is accountable. So that was the one. Various other illegal pipeline connections, sewage overflows during heavy rains. So I guess intermittent problems versus sustained problems, and the issue of rapid urbanization, which puts increased pressure on water systems, was another issue picked up. Lack of industry accountability was another one. And so waste management community-led initiatives can play a meaningful role without, yeah. Okay. And I think, is there one more? All right. Yeah, I think that was it. Sure. If that's thanks.
Thank you for this presentation. Sophia? So now we'll have a presentation from the waste minimization and waste management and resources. Who is going to present from that group? Ronald. You took the note, Ronald, so I'm going to pick on you. Would someone like to present from the waste minimization group?
We documented 3 success stories and 1 risk area.
In relation to where informal waste pickers were successfully integrated into formal systems. So the first one was Nakuru. Thank you. Was in Nakuru County. And essentially what you had was a whole system of informal waste pickers or waste collectors who were getting paid by households to collect their waste. But the consequence was that that waste was then being indiscriminately dumped elsewhere and not within formalized landfills. So the county transformed and gave the pickers a tender of sorts, where they were allocated a specific area to operate, like almost like an operating license, but they were still paid by the communities concerned to collect the waste. However, now they were also incentivized to separate because they were trained and capacitated to do not source separation at household scale, but at sort of village scale. And so they separate into organic, plastic, and all the others, which meant they were getting an additional income stream through this formalization because now they were able to sell what was recyclable. So I think that was a very interesting sort of case study where it was a win-win for the county and also for the waste pickers. And then within Nairobi, there was a case where management companies were paying informal collectors who were bringing them to central locations, but could not they could not demonstrate that they'd incurred costs, and so they were therefore subjected to a higher tax burden. So the management companies were collecting were incentivized to encourage or force the pickers to become formalized and generate invoices so that the management company could generate the expenses to reduce their tax. So that was also something that was quite interesting. And then a third one was in the case of informal pickers, they were obtaining waste from within homesteads, but also in landfills where they shouldn't have been in the first place. And they were supplying it to recyclers because the formal recycler companies aren't officially allowed to go to the landfill, but the informal pickers are in a sense allowed to do so. But what happened was they were being taken advantage of, and ultimately they ended up forming an association, a union, if you will, to really advocate to increase their rights to get better prices for the waste that they were collecting, and also access to personal protective equipment, hats, gloves, and that sort of thing. So that's been good in terms of it's created an advocacy group which has helped to formalize the system. There is still this legal issue because as they become more formalized, will they be allowed informal access to the landfills and other waste sources? So that's something we would still need to see. And then another one, which is a bit of a concern from Ethiopia, was around like full-on centralization of the waste collection system, which would essentially eliminate all the informal pickers and sort of create one single centralized system, which would impact negatively on livelihoods. And, you know, there were some concerns raised that, you know, possibly the informal pickers would just find alternative markets for their products or shut out this big company or engage in protest activities. So that's just something to be aware of, that over formalization is also a risk that needs to be considered. Next slide, please. Don't worry, I won't be as long on this one. Then we really just sort of had a quick discussion because a lot of those case studies took up most of the time. But in terms of the biggest barrier to urban waste management systems, the biggest one unanimously was source separation at the household, because once it becomes mixed, even if it's just at the village, it's very difficult to separate. There could be toxins in stuff that's used for organic material and all that sort of thing. It becomes a risk and limits the income generating opportunities. The presence of mafia in informal and formal dumps. So essentially you're paying a council tax and then you're also paying the mafia to either dump or to get your recyclable material. So there's like a bit of a double accounting going on there. And then it was also demonstrated conversely that a very structured system, such as you find in Rwanda, it's a very formalized dump. You have service providers operating the landfill. There's no funny business. So, but fundamentally, source separation was identified as the main barrier. In terms of special waste streams such as medical waste, e-waste, lead acid batteries, it was indicated that from a medical perspective, there's incinerators or private service providers, but the concern was that there isn't ongoing investment in these very important systems, and they often break down and parts are not available, and that can potentially present a problem. And the general comment was that the e-waste system, from the people who spoke, was very formalized, went to companies and was disposed of safely. And then there was one final aspect that we managed to address, and that was, were regulatory or enforcement gaps significant? And I think what we've heard from the other rapporteurs is policy great, enforcement terrible. And that's a common theme that I think we need to sort of really grapple with and address going forward. I think in some countries there was lack of dedicated formal disposal sites and a general sense that government doesn't really prioritize the environment compared to other elements. And that's a perception, you know, and even if it is just a perception guides how people think. So that is the summary of the feedback from our group. Thank you.
Thank you. I think we all agree that hearing about the various discussions that have been ongoing in the groups is very informative. It feels like we've been a part of this group's discussion as well. And I hope that we were able to learn success stories, best practices, and can take back this within the institutions that you work with or the countries that you work for, so that together we can help manage pollution. Now, it's almost 6 o'clock, so I think we're going to skip the Q&A session. And then no, that was the other Q&A where we'll be asking questions. So this will be done now. So now, please scan this. Would you like to do this? So can you please scan this and fill out the questionnaire? So maybe I can read. Scan the QR code with your mobile phone for ranking questions. Assign 1 to your highest priority, 2 to your next priority, and so on. Open-ended questions can be typed in your own words. All responses will be compiled analyzed, and summarized to reflect participants' preferences. This summary will be presented as the official output and will inform the planning and priorities for the next forum. So it's important that you complete this now so that we can compile all the responses and have something for you to as a takeaway of this forum. They have 10 minutes for this assignment, so I'll be back at 6:10. Yeah, can you help me by walking around? There are different issues so that we can help.
And so for this one, still, they have there is also one missing here. One that was on the now for over
No, that's you know, for the service. All of those things, they have sometimes love this one. That makes all that everything. It's just going to be very. So.
Such is for
Sophia, can you put up the interactive slide again?
This is to that website.
okay.
Now, this.
Are we done with the survey? I can hear you guys. Are we done with the survey? Okay. So 3 more minutes. Are we done? People in the back, are we done? Oh, you need us? Sophia, they are calling you. She's calling me. Okay, 1 minute. It's like we are done now. So we will. So we've heard from international best practices, regional perspectives, national experiences and successes, and practical solutions and interventions that can be implemented to control pollution. I would like to now invite Maria Paula Lia, Executive Director of the Global Alliance on Health and Pollution, for the closing remarks. Following her remarks, we will then move on to dinner at 6:30 outside here. And this is a networking event for us to get to know each other more and then ask questions that we were not able to ask during the day. Please, we ask that tomorrow morning you be here before 10 a.m. as the first session starts at 10 and it's a half day so that we can get started and be done on time for your flights. Recycle this, please, so that you can use it for tomorrow. Thank you. Maria Paula.
Thank you. And I will be brief because the dinner is in 10 minutes and we are all tired. And now the scope is to enjoy ourselves. So my closing remark is just to thank you for your presence, for active participation, for your energy. Of course, now we have a little bit less, but I trust dinner will make the job. To say thank you and rest well. Tomorrow we start a little bit later so that we want you to come with energy, prepare your checkout bags, go and enjoy a nice breakfast and start, energized. And everything is here. So now we know logistics. It should be easier. And then I also want to invite you to visit our website and explore the membership because, we want to strengthen the collaboration in Africa and we shouldn't stop. So that's it. I don't want to do any other closing remarks. We talk tomorrow. Enjoy our service and see you out there at the restaurant. Thank you.
Thank you, everyone, and have a good evening.